everybody, and welcome. Thank you for coming. Tonight is the Putnam County Protective Services Committee meeting here on July 22nd, 2026, 6 p.m. We will start with the Pledge of Allegiance. If everybody please rise, take off their caps. Commissioner Oster, would you lead us? Sure. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Please be seated. Next up, we have roll call. Item number 2.
Present. Here.
Present. Okay, item number 3, we have acceptance of our minutes from March 11, 2026 meeting. Pre-provided. Can I get acceptance? I guess we don't have to do anything with that. It was just acceptance, right?
Yeah.
All right, no changes. I should ask that, right? Any changes to the minutes?
Yeah.
Any changes
None for
yourself?
me,
None
thanks.
for you, all right. All right, item number 4 is a proclamation that I will read. Let me see here. Per Director Osterhout, if you care to join us up here at the table for a second, I'll be happy to read this. We have here a proclamation for a pretrial probation parole supervision week, which is July 19th through the 25th of 2026. Whereas community corrections are an essential part of the justice system, and community corrections professionals uphold the law with dignity while recognizing the right of the public to be safeguarded from criminal activity. And whereas community corrections professionals are responsible for supervising adults and juvenile offenders in the community, and whereas the community corrections are trained professionals who provide services and referrals for offenders, community corrections professionals work in partnership with community agencies and groups, and whereas community corrections professionals promote prevention, intervention, and advocacy, whereas community corrections professionals provide services, support, and protection for victims, and whereas community corrections professionals advocate for community and restorative justice, and whereas community corrections professionals are true force for positive change in their communities, now therefore be it resolved that the Putnam County Executive and the Putnam County Legislature do hereby proclaim the week of July 19th through the 25th, 2026 as pretrial probation parole supervision week, and we encourage all Putnam County residents to honor these community corrections professionals and recognize their achievements. Thank you for all you and your staff do. We have this signed by our county executive and our chairman, Dan Birmingham. Please share this with everybody that works with you. Thank you, sir.
Thank you so much.
Thank you.
Okay, next up on our agenda is item number 5. We have a discussion update on the operations of the Putnam County Coroner's Office. Dr. Neshwat was invited to be here tonight. He has sent his able-bodied assistant, John Borges. Welcome, sir. Good to see you again. Feel free to sit down right there. Yep. So,
Sort of an outline of everything that we.
so we have a motion to accept additional information. Can I get a second? Second. All in favor?
Aye.
Aye. Okay. So,
Before we sort of review this, if I could say 3 things before I forget them. First one is, just like all the cool kids in the block, all of the
Thank
people
you.
that do the heavy lifting for everything that you're gonna read about in here, is sitting in the back row, and Jenna, of course. While the coroner's office cooperates with a lot of people in this county, the people that are back there, really do all the work. They're the ones that really do. All of the things that you're gonna read about here, or you're gonna see in the slide, is done at no additional cost, to the budget of the county coroner's office.
okay.
In addition, all of the things that we've mentioned, I can't get into certain specifics. That's because with them, we have a confidentiality sign. But again, there are certain things that I just can't release. But we can give you the basic information as to the coroner's office, where we are so far this year, and answer any questions that you may have.
Thank you so much. So I will second your preemptive discussion by saying that I've taken upon myself to reach out to the coroner's office to welcome them to come in, because we do receive a coroner's report, usually monthly, if not quarterly, and everybody looks at it and we share our concerns about how many, how many suicides were on there, right? How many accidental deaths were on there, but never really given the opportunity to ask any subsequent questions. In addition to that, we have what appears to be, what I believe to be a very capable staff working there at the coroner's office. So it occurred to me, hey, we're right around mid-year, just past it. It seems like a fine time to reach out to Dr. Neshwat and the team and say, would you please come in and give us a quick state of affairs of the coroner's office? What's working for you, and maybe something that we need to look towards 2027 if there's something we can help you guys do your job better. So thank you for being here.
I appreciate that. Thank you very much. And we're also very appreciative of the recent increase in our salary, which makes things a lot easier. We could start basically with the suicides, which is one of the most important things that affects the community. In addition, we have 5 suicide cases so far this year. To put that into perspective, last year in September was our 5th suicide. And in 2024, we only had 2 suicides. It's an anomaly. Something to pay attention to and see what may or may not have been the cause of that. And in 2023, we had 14. I'm sorry, these are all overdoses. My apologies. I apologize. Go back to suicides. We have 4 suicides. And in 2025, our 4th suicide was in July. We had a total of 6 cases in 2025. In 2024, we had a total of 12 cases. The 4th was in June, and July was the 5th suicide. So it has gone up. In 2023, it had 15, then 12, and 6, and we're hoping that the trend will continue down. One of the reasons is because of the people behind me, Paul and Megan and Marla and others. They created the Suicide Prevention Task Force, which then works within the community and different organizations to be able to bring everybody together to be able to fight this. One of the things that we've done, or I would say them, is they created the loss team. So immediately after suicide occurs in Putnam County, at my notification or notification from the police, a response team is notified of the suicide in Putnam County. What they can then do is, after we've spoken to the survivors of the family, is to make arrangements to offer support to the family immediately, within whatever is convenient for them, whether or not it's the same day, whether or not it's the next day, whatever time that it happens. And they'll be better off trying to explain that to you. But it's one of the things that Putnam County does that I don't really know of many other places that can. We're a small community, small county, doesn't mean we can't be the best of what we do. In addition to that, when you flip over down the page to overdoses, so if you look at the number of overdoses, and again, there was 5 cases. In 2025, there were 6. And then in 2024, there were 2. 2023, there were 12. So one of the things to understand with overdoses is that they are considered drug overdoses. So when we have an acute death because of alcohol intoxication, it is an overdose, it is a death, but it's not counted in a lot of statistics. So while it's there and it's important, what ended up happening is that the statistics that we're able to supply to them and the information we're able to supply to them, we've broadened the definition. So they don't any longer sit down and go, okay, we had 3 overdoses. End of story. That's all the information that they get. Now they understand the nature of the overdoses, the drugs that might have been utilized, where that may have come from, and in addition to the cooperation with police departments to determine where those drugs may have come from. But we do not exclude other items such as alcohol. And as a matter of fact, I think it was 2 years ago, again, I mentioned, look it up, Kratom, which is one of the items which is in every gas station you walk into, we had an overdose of Kratom. So nothing else. The majority of the overdoses are acute mixed drugs. So there's the co-occurring system of care. That's one of the items that we use. We work with the Bridge Alliance, which is another organization, which is again working in the community. There's the Suicide Overdose Fatality Review, where they take actually the information that we have of certain overdose cases and certain suicide cases, and they do a deep dive. And they look into how many times was there a point of contact with this individual in society. Were they on probation? And we have probation, we just made an appointment day. Was there a contact there? How many times did they go into the hospital? Where were the issues that we may be able to address in the future not only for suicides, but overdoses as well. And they do a deep dive, and it changes from a statistic where it's just a person, and you say it's, one female died from an overdose. In a sense, they identify who the person is, and they create an image so that we understand that this affects every single family, whether or not it's a suicide, whether or not it's an overdose. Everybody is affected by it, and it goes back generations and countless other people that are part of this little pool. We also do the child fatality review. We have had several deaths of children in Putnam County. The difficulty there is when a child may have been transported outside of Putnam County, either to Danbury or to Westchester Medical Center to Maria Ferrari. That is no longer counted as a death in Putnam County. But again, working with the Child Fatality Review Board, we're trying to identify cases where is there something, again, that Putnam County can do to the families to support them if it's needed. We also work with Live On New York. As part of my previous experience as a veteran and also a New York City police officer, my previous experience with the Dwyer program, we continue to work with the veteran programs. There's Dwyer and Guardian, which Megan is a main mover on that. I also work with the New York State Department of Veterans Affairs, reducing access to lethal means through the VA. They're getting a grant where we're going to be taking lock boxes, and then I'm going to be going around as well as almost every county in New York State. It's a small lock box to try and reduce that period of time between a veteran's decision to say, I'm going to commit suicide, and access to a firearm. What we're going to try and do is put something positive inside the box. It's a photograph. It's a piece of candy. It's something that's going to be hopefully a break in there. And then if we can show the success of that in the veterans community, we're going to try and do that with first responders, police officers, and so on. And again, we've worked very well with a company in Washington State. We're going to basically get everything at their cost. This is working with Ben Pomerantz, who is deputy director of something very big in the VA. It's a long thing on the back of it. I'm surprised he can put it all on one card. There's also the Veterans Mental Health Training Initiative, where we try and work with the social workers. And again, part of that is under the coroner's office, but again, it's part of my previous experience. And then healing communities and studying harm reduction. So many of the things that the coroner's office is involved in directly affects the community, but I can't stress enough that it's really the people sort of behind me that are the ones that are doing it. I can make the notification, I can deal with the family, whether or not it's the sudden loss of a child, usually of an overdose, it could be a marriage, it could be a sibling, or death by, it's a suicide. The immediate trauma that happens in that period of time is sort of unspeakable. It's very difficult for people who haven't gone through it to try and get their head around it. They're trained, they're experienced, they're knowledgeable, and what ends up happening is that we offer them support immediately after the incident so that it happens. Now, whether or not they take advantage of it or not, that is solely up to them. Nothing is forced upon them, but at least they know that there are people that care and people that are willing to help them. And we work very well with them, both with the overdose and with the suicide prevention. So that gives you an idea of what we do.
So, and
And
thank,
then I go and see dead bodies.
yeah, understood. So thank you for all your services. And I funny enough, detective side note, you'd be surprised the connection to the 4-4 for life is very much in this room, more so than you even probably know right now, but we'll get back to that later. I've seen your picture everywhere. So, back to the origin of the discussion that I was bringing up right there, and knowing that it's you and your team that have to go out there and, when it is the obvious death and people are not going to work it right there, that's that interaction. You're out there representing the county, making those declarations, right, when there's an obvious death. So I could see how everything that you've said tonight would bring tremendous, the best that we could possibly do under the worst of circumstances, that trying to offer that peace or connection to people when somebody comes home and finds something that you wind up at. It's got to be a horrific situation. But boy, you brought up an interesting point, because almost any child that gets worked is not staying in Putnam, right? Any corner, any child that's getting worked, whether it's drowning, choking, anything else is at a minimum going to Danbury or Westchester.
We've had 2 deaths that are children in Putnam County. One of them died in the emergency room at Putnam Hospital.
Okay.
And the other person was a case that I handled separately, but the person, the child, infant, only 8 months old, had a genetic defect. And life expectancy wasn't beyond a year.
Okay.
So that was expected. I spoke with the doctor that was taking care of the child, and again, it was something that was expected. I examined the child, just rule out all the other things that happened, and then the body was released. And that's one of the things also that our office handles. So when you look at, let's say, the number of autopsies that we've had so far this year, it's about 20, maybe it's 19. I've handled an additional 45 to 50 calls where there's no physician, it's an elderly, what are we gonna do? So they call us. Now then, next part of it is that we track down the physicians. I hate cardiologists, I'm sorry if I'm saying that out loud, but I've had them hang up on me. You know, they've taken care of a patient for years, I don't sign death certificates, click, end of story. So now my office, myself, or whomever it may be, has to try and resolve that death. So last year we had 150 of those types of calls. And of those 150, probably about a third, maybe more, end up being signed by myself and Dr. Neshawat or Wendy and Dr. Nash, where the coroner's office is taking responsibility for the cause of death. So
Wow. Okay.
that also occurs.
That's not on our reports. We don't see that, right? We
No.
see those low
It's
numbers.
one
We
of
only see
things
the
that, you know,
autopsy
Mm.
You have an
reports.
83-year-old who hasn't seen his physician in 5 years. I'm not doing an autopsy of an 83-year-old unless there's a knife sticking out. And I've explained that to him. Is this a murder? She wrote, you know, fancy, or are we doing something, you know, we're trying to get in contact with the family.
Somebody has to sign off on the death certificate. If somebody passes, go ahead, you can.
If I may, do you have to do an autopsy if they die alone? You don't have, no, okay, good.
It's
I'll have other
certain
questions,
circumstances that the office will make a determination. Overdoses, suicide,
Yikes.
homicides, questionable circumstances as to the cause of death. Drownings, where the person may have been found in a pool, but again, this is the cause of death due to drowning. They were also older, they had cardiac medications. What's the cause of death? If I can't be specific and articulate it clear enough, then we have to do an autopsy. But generally speaking.
That's good to know. I just always understood that you had to, so that's great to know.
I don't know. Oh, okay, I'm sorry.
Was it on the whole time? John, you have to
My bad.
start.
It
gotta start
was
all
a lot of great information.
Did you just hear the moan from the rest of the room? Don't go, sweet Jesus,
Aaron,
not
you should be
again.
watching it for me.
I know, I can't see the side, I just
Ah.
checked because somebody said they couldn't see, they couldn't hear.
I'm sorry.
Oh, well, for those listening at home, this has been an unbelievable educational and fascinating conversation, and very much so for us because, like we said, the numerics that we see on those reports normally, thankfully, have low numbers on them. But like any job anywhere, once you start asking questions, you'll find out there's a lot more to it. So I will come back around to, and you might take this back to Dr. Mike and come back, but is there support from the county sufficient enough for you to do the job you need to do? Or are there things that are severely lacking that you come here today and say, Tom, we really need this here in Putnam County?
I would say so far we've been doing more with less for a long period of time. So it's not something that we've, absolutely need this. We just actually did a renovation of the morgue, which was an important renovation considering how old it was. And we share that.
I sorry to interrupt you right there because that is a different line of questioning, which I did bring up because doing the research, I did find out prior to my arrival here, there was a commitment from Putnam County to spend $40,000, which was supposed to be matched with $40,000 from Putnam Hospital to be put into the morgue. And
They did.
okay,
Well, they did the renovations.
They did the renovations.
I don't know if they gave you the money.
No. We gave them the money.
We give them the
We cut a check for $40,000. I would like to know for sure if $80,000 worth of improvements were made to that room.
That would require somebody who's familiar with construction.
Correct.
But I would tell you that they put in a new ceiling, they put in a new floor.
Floor.
Sometimes that can be very messy.
Yep.
And we needed new cabinets because some of them were kind of destroyed. So all brand new cabinets, all brand new flooring,
The new lights, I got
and
you.
new lights and
right.
things of that nature.
So
Which
if-
makes it a lot easier. They can do something with the refrigeration unit, but they've been aware of that for a long period of time.
And if 80,000 was spent, then all is well, because that's really just, I mean, because this happened before I got here, but that was my observation. And I know I did research. I found out Putnam County definitely filled out a check, sent the check was cashed. So, and yes, improvements were done. And if $80,000 worth of improvements were done, you and I might not see 80,000, but it might have cost 80,000 between engineering and everything else that went into it. But I want to
Really,
ensure.
it's a morgue. So
Yes.
that understand that's different laws, that's different regulations.
But John, just that's why, and thankfully you're here. You need the tools to do your job and do it well, and I'm aware of that. So thank you for coming here today, and I'm going to continue to have that conversation with Dr. Mike, because you play an incredibly vital role, right? So even after the fact, the work that you do helps those guys do their job, right? So there's so much centered around your office being able to function well and do things correctly that I'm very much aware of it. I'm concerned with it. I want to make sure that things are going in the right direction. I like the team that we have there, and I like the open line of communication that I plan to continue to have with your department, so that we can, if there are problems, perhaps we can try and, work them through together.
We've been very fortunate in being able to work with all of the local, police departments, from Carmel to the sheriff's office, particular, and we've never really run into a roadblock where it's become that difficult, unless it was state police from Cortland. That's another problem. But everything that we've done, also, they'll explain to you if they do speak, is that not every case or every time we get called or every time it's a statistic is it easily put into one particular category or another. Particularly with suicides, or unless I am absolutely 100% convinced that this is a suicide, I do not mark suicide. It'll be undetermined. Now, whether or not the person intended that could be, absolutely, but unless I'm absolutely positive because of the destructive nature of that. But still, it doesn't mean that we then ignore the individual family that's present. They still have the loss team. They still have other people that are offering their support to them. And that's one of the advantages. If you went back and asked me in 1988 when I was doing something different, would this have ever occurred to anybody? And my answer would have been no. It never would have occurred to me. But I've been fortunate to work with people like Megan and Marla and, Lauren and Shannon and Paul and Sara, and, the list goes on.
Right.
I've been very fortunate with that. And we have a great cooperative, so that any time something comes up that is a barrier or something that we see, what do we do to address it? And nobody says, well, everybody wants to look at the problem. Okay, how are we going to fix it? And how do we fix this problem? And I remember when I first came here, there was several suicides of children. And they started the suicide with the, task force after that. And we're aggressive, going into schools and talking to social workers and so on. And we haven't had one since.
Right. Fantastic.
So again, these are things that they do day in and day out, and I don't think a lot of people notice it. They see me, I show up, but they don't really see the follow through, and that's what they do.
Well, thank you for that. And in addition to the other resources, I want you and your office to be aware that this team is very much, aware of what it is that you and your team are doing, and we're here to support as well. So we're making plans now for 2027, and we'll look and we'll talk with Dr. Mike to that effect. And if anything, like you said, if there are essentials that haven't been gotten, maybe that's something we could look at for 2027.
Remind him that he offered me a flashing light so I don't get forced off the highway when I'm driving on the side of the road to go to a motor vehicle accident by a tractor trailer truck. Just something that says, hi, I belong here.
Just for the education of those in the back room, when John was a detective, he used to put the metal one on top that stuck to the car when red lights.
Absolutely.
But that was a long time ago. Colleagues, any questions for John?
Go ahead.
Okay, I just wanted to ask you,
Yes, ma'am.
with the immediate trauma of a family, you offer support. What type, like the time frame and follow up with that family? How does that?
It could be immediate. We've been at the scene where I've spoken to the survivors that are present, and some of the individuals were in the mindset that they could understand what we were explaining to them. And the first part of it is that they have to agree to this. This is not something they just get a cold call out of the blue. This is something that they have to understand is going to happen, and they have to agree. So it's not something being forced on them. And then what would be convenient for them to try and reach out to you. And within a few days, they had to sit down with one of the survivor family members. Sometimes the family members, there are 10 people there, 9 of them are nowhere near any condition to understand anything that's going on. But there might be one person. And again, we have a folder that we hand to them that they have, that has all of the numbers, that has the points of contact, that has places that they can call.
Megan just held it
Megan
up.
just held up
The one thing I forgot in the truck.
I think my question is, though, I know they have that, but do you ever follow up and give them a call? like,
Sure.
The following week, or, yeah. Megan?
Yeah, please,
Yeah.
if you don't mind,
No,
please do.
Megan,
Yeah,
just-
come up to the chair so that the microphone could be heard.
Yeah.
No, we'd love
No, this is very helpful, and
This is just, yeah.
and the trauma that exists on any given family, even if somebody had the notion that something was going to happen, but unfortunately, a lot of times with suicides, families are walking into scenarios that they did not see coming. So, your ability to communicate with anybody at that point is beyond difficult as they try and grasp what's going on. So.
Exactly. So I just came prepared, obviously, to support John and the role that he plays in the coroner's office as it relates to the suicide prevention work that we do in the county. I'm Megan Castellano. I'm the co-chair of the Suicide Prevention Task Force here in Putnam since 2013, and I'm also the co-coordinator for the Putnam County Loss Team, which John mentioned earlier is the team that goes out to do outreach to survivors of suicide. So he mentioned the folders earlier, which I brought extra copies. John doesn't have any because he gives them away every time he goes out and responds to a call. So I just wanted to note how important that is. And I think that of all the people that work in the office, you know, you're the most fastidious, if I might say. You burn through these, you know, more than anybody, which is great because that's the whole purpose of them, is to make sure that they get out to families. So I don't know if I can, you know, make a motion
I
or
have
whatever
mine
for
at
you guys
home.
to be able to see those, but I just wanted you to
I
have
mine at
them.
home.
But just to specifically speak to your question, Legislator Adonisio, since the inception of the loss team in January of 2025, we to date, this is a 22-page report that I just prepared and to send up to the people who provided the funding for the loss team, the Office of Mental Health and the Suicide Prevention Center of New York. We've had 34 responses since January of 2025, and that's connections with people who have been impacted locally by a loss to suicide. And of those, all but 2 were initiated as a result of outreach work by this gentleman. So, like, we get a text saying, you know, there is suicide, you know, wherever it is, this person is on scene. I'm going to give them the folder, and, you know, we're standing by with the phone to be able to provide support, to provide information, find out where they live. You know, some cases it may be a surviving spouse. There have been several cases that have involved young children, you know, school-age children, and making sure that the schools are liaised and, you know, that there is support wrapped around the family. And just to John's point, you know, some people, engage with the support and have since been connected to the support group for suicide survivors. Other people, you know, they may have support within their own family or, you know, their own community, but at least they know that we're here. So, and I think we all know that, you know, grief is not a time-bound or linear process. So what's great about this is that they're getting information, as John mentioned earlier. They may have what they call Swiss cheese brain at the time of the loss, but they have this information that he's giving to them so that when the time does arise, when they feel like they do need some support, they know who to reach out to and they know who to contact. So I just wanted to also mention, if I might, that we have, there's something that you're probably not familiar with, and it's called coroner envy. So, and I just say that, you know, from a statewide perspective, you know, all the suicide prevention coalitions in New York State, they do not have what we have here in Putnam, which is, you know, that the coroner is present at our task force meetings, gives us data in real time about actual suicide deaths so that that can inform our prevention work immediately. We're not getting a report from the state 2 years later that tells us what was happening here 2 years ago. We're getting information about what just happened, you know, 2 weeks ago or, you know, 2 months ago. And that's been critical, as John mentioned earlier, in being able to inform the prevention work that we've been doing, not only with youth, but, you know, all of the statistics that he provides to us in real time at those quarterly county meetings. And it has also resulted in us being able to secure funding outside of the county for county suicide prevention initiatives, including the development of the Putnam County Loss Team. And we also just secured a grant for $132,000 over the next 3 years to be able to continue suicide prevention work here locally. And that is because of the reputation of the coroner's office here in Putnam County as being present, being active, and being involved. So I just, came tonight just to, further amplify the role of the coroner's office and the important work that they do, and not only how it impacts our community locally, but also, the perception of our community at the state level and, probably beyond that as well. So thank you for letting me share that with you.
Thank you so much.
for
I
sharing
do need to make a motion to accept the additional Project Hope that was given out to us. You have a second?
Second.
All in favor?
Aye.
And amazing. And thank you so much for coming. Thank you for the education that we've all gotten here tonight, and I anticipate great follow-up afterwards.
One other thing with
Go ahead.
going side to side with that is also the overdose prevention. And they have what's called an anchor folder, which is, I guess, being printed. And that's Shanna and Lauren. And it's sort of the same thing. I mean, you have a suicide loss, but you may have a child that's lost, that's been battling addiction for years and years. And all of a sudden you come home and you find your child deceased. Nobody should lose a child. That's one of those hard things. And it's even harder when you know the battle that the family may have been going through for years. And so they're offering support as well immediately to the families when they have a loss. And it sort of works in the same dynamic. I find out, I understand, this is a probable overdose. It takes us time, 6 to 8 weeks for a toxicology report to come back. And not always is the toxicology report going to indicate what you believe at the crime scene. We've had an individual, there's crack pipe, there's a lighter, there's 10 bags of crack. He had a cardiac event. So even though all of the scene indicated that it's a probable overdose, it was actually a natural event. So that they were aware of that information, but it doesn't go into the statistics because it's a natural death. So it's one of those things that they're aware of, and again, can offer support, and again, can reach out to the family, even though the death, I mean, we've had ones where, it's a head bleed, directly due to the use of cocaine. However, it goes down as a natural death because the cause of death was the head bleed. Cocaine use was one of the contributing factors, but is not the cause of death. So again, it goes down as a natural death. But again, they're aware of the situations where that happens, and still are able to give support to the local families.
Thank you. Nancy, do you have a question?
I apologize
Oh,
for
no problem.
rambling on.
No,
I'm sorry.
I could listen to this. I mean, it's very hard to listen to, and I want to acknowledge that. And
That's why I'm invited to parties all the time.
just can't imagine, as the mom of a first responder is one thing, but understanding and having experienced when a coroner comes to the house, I thank you for your work and your team in the coroner's office. I have Swiss cheese brain just thinking about, all of the experiences that you don't get over. And I do have some questions about the statistics. And one thing I do want to say is, I look at all of these programs from the people behind you that we have, and I'm always conscientious of that when I read the coroner's report monthly, and they correlate with each other always. I can see how they're related to each other. And with that, speaking of old information, it would be really helpful to me if on the spreadsheet, much like we do in the budget, if we could get 2 prior years, so that when I'm looking at it, we have, I guess maybe you do that at the year end.
You receive something that sort of looks like this? Because
No,
basic,
ours more of a, like a
It's
spreadsheet.
more like a
she's
spreadsheet.
holding up
Yeah.
right there.
So
Larive can do that. She's out for
Yeah.
2 weeks. She had surgery, so she's not going to be around.
yeah.
But that can be easily added because she
It's-
maintains the statistics regardless.
And I think we funded a position for, the administrative work for this a while back, didn't
There was
we?
a secretary, right?
Yeah.
Yeah,
but
Lorraine.
yeah, okay.
She's the one that, I mean,
We made her,
usually I ask for stuff and, I'm thinking that it's going to take, a week, working in the city or something like that. And it's done like a couple of hours later.
that's great. And
So
it
she
would just
does.
be helpful as I look at this, because I always compare, well, where were we at last year? What program did we implement this year that maybe shows that it went down or it went up and we unfortunately canceled this program, and has that had an effect on this. And I do have questions about the report. Are these cases, the way they're categorized, are they handed down to you by the state? Do you have a certain category, or can you
So
guys
there's two
determine
different
your
things
own?
on a death certificate: cause of death, manner of death. So when you get cause of death, let's say it's blunt force trauma, most likely it's a motor vehicle accident. It'll go down as an accident. However, most overdoses are also considered accidents. It's an accidental overdose, usually mixed drugs. So sometimes that alters and skews the number of accidental deaths we had in Putnam County. It doesn't mean everybody drives around like a madman. So that's one of the things that working with the Suicide Prevention Task Force and the Overdose Prevention Task Force, that they understand that we have a particular case, it's going to be this, but it will be carried as a natural death because of other underlying. You have somebody that's in a motor vehicle accident, they die from the motor vehicle accident, but they would have died from an overdose because of the level of fentanyl and heroin.
I understand that. I guess
I
my-
apologize.
That's okay. My question really is, can the categories be worked with? Can you guys develop more or take away, or can you?
Sure. We can make it however you would like it to be.
Not me. I mean,
We
I
can make it
would
as
never
clear and easy as we
suggest
can.
But-
Do you have a standard that if I can, Nancy, right? That's what I think you're trying to ask?
I think I'm having a hard time.
Let me mansplain it.
Oh, Jesus.
What I
Move
heard
over here, I don't want to get the blood.
what
on.
I heard her ask is, does New York State tell you exactly how you have to categorize
What
these
these
things?
does
Death certificates, yes.
they don't tell you how
Our
to
forms,
do
no.
they come up with these categories, or so you can come up because
With the exceptions of the manner of deaths on the death certificates. That's finite. So it's murder, homicide, suicide, natural, undetermined, and so on. Those are the categories that it has to be fulfilled in.
So in regard to the category second, I don't think you have this, but
do
the
not.
second from the bottom in red, from accidental / undetermined suicide cases, overdoses. So we have suicides that don't involve drugs, and we're not categorizing them. Are they're lumped in with the accidental. Maybe this is clear, and I'm just trying to be too specific. But I would like to be.
I'm at a disadvantage because I don't have the
I know.
document, but that's okay. What we can do is when I speak to Larive, we'll get that printed out. Oops, sorry.
So, John, you'll see the red lines there.
Yeah,
on
pending.
in each quarter, right? It's divided up by quarter.
Mhm.
So we got those red lines at the bottom of each quarter.
So we have suicide cases by overdoses. We have suicide cases by ethanol. I mean, or it could be an accidental death by ethanol. There are suicides that are accidental. So you've got it. You've got it categorized 1, 2, 3. It's either accidental, undetermined. I don't know. That just guides how we think about mental health and drug overdoses and suicide. Some are drug related. Some are just. Don't want to say plain suicide, but there's any manner of how someone does it.
As I've said before, and I'm sure everybody sort of in the back row that's dealt with a family member that's lost somebody to suicide, it's one of the most devastating things to happen to anybody. I wouldn't wish it on my worst enemy. And I apologize for anybody if we've spoken about something that's sort of taken the Band-Aid
No, I
off.
appreciate the bluntness, and it's
So,
and
But to
I'm
understand,
here.
unless I am certain 100% that this is a suicide, it does not go down on the paperwork as a suicide. It'll go down as undetermined because I cannot make that determination. A lot of times what ends up happening in specific cases, as an example, there's enough medication in their system to kill them. There's also enough medication in their stomach to kill them again. So when you pass away, your body stops basically doing everything. So is that a suicide? Well, the family tells you he was going to see his brother the next day for lunch. He was starting a new job on Monday. He was getting a new apartment on Thursday. Does that sound as if it's going to be somebody that's suicide? I can't tell you.
Sure, but there's
So that's the way it'll go down, is undetermined. And that's one of the categories.
So there's accidental, undetermined, and suicide cases all lumped in with overdoses. There's no category for suicide, gunshot wound.
There should be.
There's no category for
Should be suicide right here. You got 2, and then
is that-
suicide 2,
So,
and then suicide, I know that there's one more, so.
we
I mean,
had-
no, I'm sorry, that's 4, so that's the number.
so we had the two.
If
the
you look
two-
January to March, it has suicide 2.
Okay, so January to March, we had 4 suicides.
And up until June, we had 4 suicides, correct?
Okay.
I think she's also looking, when you talk about accidental.
Oh.
Sorry, Shanna Siegel from the Health Department. Accidental would include accidental fatal
Oh,
overdoses.
Correct.
So what the red on the bottom is just combining a few different categories,
Gotcha.
but they are broken down individually.
So
Is-
there were 4, the 2 in red is different from the 2 of suicide up top. Gotcha. So there were 4. There were 4 suicides January to March. And there were 6. So therefore there were 6.
Last year.
No. Okay, no, this is 2026. So we have
You have 2 in January to March.
no, we have 4, the way you're
She's saying
explaining it.
2 in the black, 2 in the red.
2 in the black, 2 in the red, and then we
in the
have
first quarter.
2 more April to June, and then we have 3 more April to June. So
I will
that's
find out why it's subdivided that way and
Yeah.
ensure that it's a
that's
little
like
bit
we
clearer.
had like
It does
we
get
had-
complicated
we
with
had 8
overdoses.
suicides according
Right.
to this.
Yeah, it shouldn't be. It's
or
4.
maybe not, right? Like we'll find out, get clarification on what we're looking at, those
Right.
categories.
Yeah,
Because overdoses are usually categorized as accidental. Again, unless there's a particular intent behind it that
I'm
I
more
can
concerned
articulate.
about. I'll put it in writing. I think
Okay.
it'll.
My
be,
apologies for not
Don't-
being aware of this.
No, I didn't. I just don't understand
My
how.
documents look
I
different.
don't understand how this document operates.
I'd be
That's all.
told.
Do you have any other questions?
No, thank you. Thank
Okay.
you again. Your work, you're the one on the scene, dealing with the family in the middle of the night on Christmas Eve, and I can't tell you how appreciative we are for you and your team. Thank you.
Thank you.
So we could, any other legislatures with some specific questions? Great, thank you. Thank you.
Thank you very
Thank you, John. Sorry, do we have any public comment on?
Hi, I just have
Deputy-
one more thing to add. Again, Shanna Siegel from the Health Department. You all mentioned it before when you talked about when you look at the data that you get, it's not just the numbers. There's a lot of work that goes on. But when somebody is in New York State, when somebody is elected as a coroner, their sole responsibility is death investigation, right? So all of the other things that John named, he's doing because he wants to be doing them. And I like to share that in the groups that we work with and out in the community so that people know that when someone steps into those shoes, they don't have to do all those things. And we really do rely on it. And like Megan said, I will kind of echo that the nuanced data that we receive from the coroner's office informs our programming day to day. And John, Legislator Montgomery asked, can you break this down any other way? John knows that, looking at alcohol or ethanol as the coroner's office might look at it, that we want to know about substance-involved deaths. We want to know about alcohol-involved deaths. We want to know about people who were maybe known to use substances prior to their death, even if that wasn't the cause of death. And so all of those conversations happen, again, not because we have coroners in Putnam County, but because of who we have doing the work. So it's very, I think, very important. Thank you.
Thank you for that additional information.
Hi,
Hello.
Laura Johnson from Department of Mental Health. I just wanted to kind of reinforce what everyone has saying. I first started working with John on the Healing Community Study in 2022 in an overdose prevention capacity. And at the state level, even a national level for that National Institute of Health grant, there was what Megan had called that coroner envy. So we've had several statewide and nationwide organizations approach Putnam County to be an example for these nationwide and statewide programs. So just wanted to put that in there, how lucky we are, not only from overdose prevention, but now for the fatality reviews that we're working on. So
Thank you. Thanks so much. Any additional comments from the public on item number 5? It was an excellent discussion. Thanks to everybody. Next up, item number 6 for discussion. We have our collaboration between mental health and probation. I'll invite Commissioner Servadio and Director Osterhout up to our table here to give us a discussion on an initiative, right? between mental health and probation. Welcome, both. The green light on the microphone is on?
Yes, it is.
Great. Thank you so much. So, go at it, gentlemen. What do you got?
So I'll be brief. This is a pretty straightforward initiative. It's a outcome of our suicide overdose fatality review that Coroner Borges alluded to earlier. This is from our recommendations committee. As was stated, we review fatalities that occur from suicide and overdose that happen in our county. During one of our cases in March, it was found that an individual had touch points with probation but had very little connection to treatment. And so we're lucky enough that Director Osterhout was involved in that fatality review. He's very involved in our recommendations committee. He's been an instrumental member, providing input, proactively participating and giving his own input. And that allowed us to move forward with creating this MOU between the Department of Mental Health and Social Services and the Department of Probation. The idea here is to connect folks who are involved in either pretrial supervision or post-conviction supervision with access to peer recovery advocates. It is a proven modality that when folks are connected with peers, they are better connected to services, have better outcomes when it comes to recidivism, and also it is provides rapid service linkages and also access to harm reduction services. So we're very proud to be able to say that this collaboration will move forward, and let Director Osterhout add anything if he likes, but we're happy to take questions on this initiative.
Thank you. Director?
So we haven't actually started making any referrals at this point. We've just launching this initiative. In fact, at our staff meeting on Monday, Lauren Johnson came over to talk about it and inform my staff how we can make recommendations and get people connected with a peer. Our hope is that that will encourage them to participate in treatment more, but also to give them a positive connection to the community, because a lot of our people we find lack that social network of support that we take for granted. And this is a good opportunity to get them involved with somebody who cares about them, who has the same kind of lived experience. And quite frankly, I'm hoping that some probationers will graduate and become peers and can actually start working with our people that way as well. So this is something I hope really takes off. Yeah.
Wonderful initiative. Thank you both. Colleagues, any questions?
Just a comment. I think this is a great program. We all know how effective the Dwyer peer-to-peer is for our veterans. So I think this is wonderful. Thank you for doing this.
I do have a question. Will the peer advocates be on probation? Like how are we going to recruit peer advocates? And I see eventually, I think it's a great program, and I see eventually it should and needs to be funded. I know there's no fiscal impact right now. I can tell you, peer-to-peer, especially in recovery, is the only way it works.
Yeah.
So with that, as you hear, I'm a big advocate for this, and I'm really excited about this program, especially, considering how we need mental health and public safety to collaborate and talk to each other and work on these programs together. And I think this will go a long way with preventing, recidivism, long-term, reoccurring crimes, and just going out into the community, and it'll just make our community better. And I think people will recognize and see progress. So with that, how does it work? I guess you have a peer advocate. Where does he come from?
So we have a decent cadre of peer advocates in the county now. I should mention that this initiative is largely based off of the work of our dual recovery, Lauren Johnson. So she really put this whole thing together, and she has very close connections with the peer community in Putnam. So our plan is to use that current peer community, but it's also been a big push of our department to try to increase that group. As we know, there sort of ebbs and flows as far as the accessibility of peer advocates. We're hoping to build that group up with, we've done that through, our opioid settlement funds. We've provided some positions. We're hoping to provide some training opportunities, certifications for folks to be able to continue on with that work and stay involved in that work. But our plan is to use the current group that we have.
So my image of somebody on probation, wouldn't work. Could it work? You have somebody on probation. I know people who are on probation want to do things that make themselves look good. They start doing community service. They start being active in the community and they want to just get off probation. So would a program like that work with someone on probation? You're talking peer to peer. You want somebody in it that's really in it.
I think that it would work for certain probationers. I would not be comfortable putting a probationer who had been with us maybe 6 months or something like that in this kind of position. But somebody who has been on probation for a while, has demonstrated a real commitment to work on themselves in their own recovery, maybe with a peer as well. That's the kind of person that we want to see referred to an agency who might have a peer position available, and get them trained and certified. And yes, I think that there's money available through mental health. I won't speak for them, but where they could train people to be certified to do this, and then they can actually get a job. And we heard at our staff meeting the other day that jobs could pay anywhere between maybe $50,000-$60,000 a year. That could be a life-changing thing for some people on probation who are used to working more low-end jobs. So yes, I'd like to see probationers do this. Frankly, that's one of the reasons that I'm really excited about it, because I think it'll work better if a probationer or somebody who's recently come off of probation and really been successful is a peer for our people. I think it won't be just the mental health concerns. It won't just be the substance abuse concerns, but it'll be how do I deal with my probation officer who's coming to my house or who's making me report or making me do things that I don't like? Why is my probation officer doing that? And having a peer being able to explain how they came through that and maybe what the probation officer's reasoning might be. They might take it better from a peer than they will a probation officer.
Well, thank you so much for this initiative. Again, I'm really excited about the collaboration with mental health and public safety. I think that really serves our community. So I'm excited to see what comes of this. Thanks.
Thank you. Any other questions from other legislators? Any public comment pertaining to this?
Can I just ask one question?
Please do.
We're scheduled to be on the Protective Committee and also on the Health Committee for the same presentation.
This was a warm-up. You guys
Do you
did
guys
well.
want us to do this again for the Health Committee?
No,
Or
let me just make sure I have my questions from the health committee regarding this. I think I just
Because it's just
said,
FYI.
I think I, basically asked what I wanted to ask regarding, what item number is it on the health
Five.
committee? Five.
It says it's on for FYI.
Yeah, so, there's no budgetary associated with this and there's no fiscal impact. But, again, I think it's a good example of how public safety and social services can work together. That's all I was going to say. I just said all the things, I think, without even reading my notes. I said it.
And I like what I'm hearing, what I'm not hearing. I think any program that doesn't come with a list of constraints, when I look at the individuals working here for the county and the people in the back row, and we have a good idea like this, and we say, get at it, without saying, here are the 27 things you have to do or not do, I think is always a good thing, right? Because we can come back 6 months now, 8 months now, and talk about what worked and what didn't. And I have high confidence in this team that you're best left to your own devices to come up with what's best for our residents. So thank you in advance of what you guys are going to do with this, and everybody else who can make this a great success. Thank you, gentlemen.
Thank you.
Thank you.
Thank you.
All right, that was item number 7. No, I'm sorry, item number 6. Next up is number 7. We have 2 great opening acts here, gentlemen. Deputy, care to join us? We have 2 great opening acts laying up for you, teeing up a great discussion. So, welcome the Commissioner and Deputy Commissioner from the Bureau of Emergency Services. Thank you for coming in, gentlemen. For this particular item in our discussion, was an inquiry that was put forth pertaining to July 4th storm and the county's response. As we all know, now we've had subsequent weather emergencies to deal with. The job has been an absolute hit the ground running for both the commissioner and the deputy, so thank you for being here tonight. If anything that you guys feel part of the discussion is confidential, we could certainly take that offline. We could do executive session or different at a different time. But I thank you for coming. But with all that transpired on July 4th, perhaps we all come out of this conversation knowing something better than what we did before. Or maybe you guys already know that as of July 5th, and you can share that with us. So you had been forwarded a couple of questions, and thank you both for being here. If you don't mind, sir, can you give me a bit of a summary of what you think happened there on July 4th?
Sure. Good evening, everybody. So as everybody knows, we had a severe weather event hit Putnam County on July 4th in the form of a severe thunderstorm. So normally we would do an after-action review on our own for this type of event based on the aftermath and the amount of damage sustained. It wouldn't usually get to this level, but we're happy to answer questions and show our level of professionalism within the Bureau and how our people respond to events like this. So it's important to note that this thunderstorm was not something that was predicted or planned. It came out of the blue, essentially. We had no severe weather up until the time that the National Weather Service issued their weather alert. So by the time they issued their weather alert, the storm had already been upon us. So we had already received calls at the 911 center reporting trees down, wires down, things of that nature. So hearing the activation, it's my responsibility then to decide what the next course of action would be, right? So it's up to me to determine whether the Emergency Operations Center would be activated or not. So in this case, I began to do what's called enhanced monitoring of the situation. So I canceled plans to go out. Everybody knows it was the 4th of July, and we start listening to radio traffic, what calls are coming in, how severe the storm is getting, whether there's any significant damage to infrastructure, fires, building collapses, flooding, things of that nature. And in this case, what I was hearing from my staff and the radio communications was that there was a lot of trees down, a lot of wires down, but no real significant damage to our infrastructure or injuries or critical incidents that would require the activation of the Emergency Operations Center. So I would like to take the time to go through the questions that were in the memo so that I can fully explain the concerns that you have, and we can discuss each as we go along.
Great, thank you.
So the first question is about staffing. So on the evening of July 4th, we had 5 dispatchers working in the 911 center. That would be our typical staffing for a Saturday evening, regardless of whether it was July 4th or not. I spoke to our center supervisor, and she advised me that typically the 4th of July doesn't warrant adding additional dispatchers because the volume of calls that are of an emergent level aren't there. So we get a significant number of calls for fireworks and parties and things of that nature, but nothing that overwhelms the 911 center or our emergency services staff. So once the emergency alert was received from the National Weather Service, what adjustments were made to the staffing of the Bureau or 911 center? So after the storm was upon us, we hired an additional 2 dispatchers for the remainder of that evening, and we had the center supervisor report for duty as well. So we increased our staffing from 5 dispatchers to 7 plus the center supervisor. So in an incident like that where you have a storm that was quick moving and was over within essentially 30 to 45 minutes, it takes time for that additional staff to get in, but there's a lot of calls coming in at that point for things like wires down, trees down. So that was the adjustments that were made to staffing levels. As far as staff performance, I spoke with our center supervisor, and she informed me, and I agree 100% that our staff performed amazingly. I have some statistics as to the number of calls that they handled, which I would like to add into the record. So at the busiest time was from 8 to 9 p.m. with 109 calls to 911 and 82 administrative calls. We also made 66 outgoing calls during that time. During the next hour, there are 37 911 calls, 58 administrative calls, and 57 outgoing calls. So, during those 2 hours, there were 144 CAT events created. And again, most of those were for wires down, trees down, things of that nature, need for DPW, need for NYSEG to respond, but nothing that was of significant enough nature that would warrant opening the EOC. So you have to understand that if we make the decision to open or activate the EOC, number one, it requires people to respond to our 911 center or our EOC. That puts the same people that you want to keep off the street and out of harm's way sort of into harm's way because they have to come in to do their jobs, right? So it's kind of a double-edged sword there that you're asking people to come in if necessary to help others, but if it's not necessary, you don't want to have them jeopardize their safety either, right? So that's always something we consider in addition to other things like if we activate our EOC, that puts a strain on resources available to other counties to the north, to the south. Dutchess County and Westchester both got hit much more severely than we did. So to activate our EOC in a situation that I didn't feel was necessary, then draws resources from those counties, in particular from power companies, highway departments that we might be sharing resources with, first responder agencies, things of that nature. So as far as staff performance, I think we did an outstanding job. I would like to read a letter that was sent to us from the patrol sergeant that was on duty at the sheriff's office during the event. It was addressed to our center supervisor, and it reads as follows. Cindy, meaning Cindy Jacobson, I wanted to take a moment to recognize the outstanding job the dispatchers did this evening. Between Kent, Carmel, Cold Spring, Brewster, New York State Police, and the Putnam County Sheriff's Office, the dispatchers handled approximately 122 calls for service between 15:30 and 22:30 hours, with the majority of those calls occurring within a very short period of time due to the extreme storm. Despite the high call volume, they remained calm, professional, and organized throughout the shift. They did an excellent job prioritizing calls, ensuring emergency incidents were dispatched first, and efficiently managing available resources. Their ability to keep operations running smoothly during such a demanding period was impressive and played a significant role in maintaining effective service to the public and our deputies in the field. Please pass along my appreciation. Their hard work and professionalism should not go unnoticed. And that was submitted respectfully by Sergeant Robert Weinberg. So I think that reflects the same feeling that the center supervisor and I both have of the level of professionalism that our dispatch center displayed that night.
That's great. That's awesome that he wrote that. And
It's very good.
Yeah.
Obviously, people tend to hear about the things you do wrong more often than
it's always
the
the
things you
sound
do
guy's
right. So
fault. We
anytime
hear-
you,
in rock and roll, they say it's always the sound guy's fault. In the EMS, it's always the dispatcher's fault. So I'm
Yeah,
really
so
glad to.
we really appreciate letters of support like that we receive that are reflective of a job well done.
Okay, that's right.
Really nice.
So to answer the question, the performance of the staff on duty that night far exceeded expectations based upon the review. So we'll move on to reaction. Is there a storm preparedness plan? And if so, was consideration given to activating the steps in said plan? So there is a storm preparedness plan in place. It's a little bit more geared toward more severe storms, like hurricanes and tornadoes and things of that nature, where we have some forewarning of the event that's about to strike us. So a lot of the criteria in that plan didn't apply for this type of incident due to the magnitude of the storm and the fact that we had no prior knowledge of it coming. So we did take some time to review that plan and adjust it as necessary to reflect needs of a severe weather event that is not necessarily a tornado or a hurricane. As far as what's in the plan for the 911 center, they did conduct emergency notifications according to established protocols, assisted incident commanders with communication support, and facilitated on-scene emergency communications as required. So again, a job well done by the 911 center. I think we already touched on the activation of the EOC.
Yes.
We also, as an after-action review, looked at our notification procedures and made sure that we have up-to-date information, again, for our EOC activation, and have tested the same type of emergency warning system that the National Weather Service used right here in Putnam County. So didn't feel the need to activate the EOC, but we're certainly capable of doing it had we needed to. Once the National Weather Service dire warning was received, I think everybody pretty much knows the verbiage. There was an alert for a severe thunderstorm warning in effect. That came out at about 8 o'clock. The warning was until about 8:30. So as I said before, the warning came out at about 8 o'clock. Before 8 o'clock, we had calls that there were trees down and wires down. So there wasn't really time for any additional warning to go out, and any warning that we would have sent out would have been redundancy, reached the same people with the same message. Right. So there was no activation on our part of the public alert warning system, which we could have done had the National Weather Service not already done it. So for future events, if there was not a warning of that nature, we would activate our warning system, which utilizes the same technology that the National Weather Service does. It's all kind of connected through dishes through New York State, and we do have that capability. Just didn't have time or the need to repeat the same message.
If you chose to do that, that message just goes out to everybody that's within the Putnam Towers, right? In other words, for your purposes?
So you can set up selection groups. So you could have a notification go to, for example, just our command staff within the Bureau, or we could go to a certain radius within Putnam County of an event, or it could be a regional thing. There's a lot of different choices as to who you can set up or that's already set up by default to choose in that warning system.
One of the great things, or smart things about that is if somebody's here with a 518 cell phone, they're in Albany and they're in Carmel at the time, they will get the message. If you're from Carmel and you're in Schenectady, you won't get the message because you're not in the direct zone of possible danger. Please forgive me. Please
Sure.
go ahead.
So along those lines, for those of you that were in and around Putnam County, you received the National Weather Service alert. But if you were in Florida on vacation, you would not have received that same alert. It's based on your location at the time. There's some questions as far as notifying chiefs, fire department chiefs to stand by in quarters with ready-to-go fire department and EMS services. So again, that's a situation where you already have the storm in place and doing its damage. So we can ask the fire department in those circumstances to respond to fire headquarters to man your response group. But that puts them in harm's way and potentially unnecessarily, because if there was an incident in their jurisdiction, we would then call them out if needed. But just to ask them to go to the firehouse during a snowstorm of that magnitude, a thunderstorm of that magnitude, is kind of, a tricky situation, because you don't want to put all those people in harm's way getting to the firehouse if they don't have to respond to an emergency. So had we had warning of this storm coming, we would have asked the fire departments to say, hey, can you ask you guys to put a duty crew together to be at the firehouse and ready? Because this is probably going to be a bad event, and we're more than likely going to need your services. But because of the nature of this happening so quickly and not really having the opportunity to pre-plan in that regards, we didn't take action to call the chiefs to say, man your stations. I think that usually in the volunteer service that they kind of realize what's going on and they'll say, hey, let's get some guys down to the firehouse so that we can respond if needed. As far as EMS services, most of the EMS agencies now are paid in Putnam County, so they were fully staffed with crews ready to go at both the basic life support level and, of course, we have our ALS services in Putnam County, so there were 4 paramedics on duty that were also ready to respond to emergencies. There's a question about county battalion chiefs notified to respond or stand by at the ready, and the same kind of situation applies. They really have nowhere to go to. The battalion chiefs basically operate out of their houses, and if we were to activate them, they had nowhere to go, but we would also be potentially putting them in harm's way to go to a firehouse or some other staging area. And for the duration of this storm, we didn't utilize or have a need to utilize any of the county battalion chiefs or coordinators, as we call them, because there were no significant events that would require their services. Was there an open line of communication between the Putnam County Sheriff's Office and other police departments to ascertain what current assets were available? At the 911 center, we dispatch all of the Sheriff's Department road patrol, so we know what assets are available. We also get reports from Carmel and Kent as to the number of road patrol personnel available. I don't know the number, nor would I think it would be appropriate to discuss staffing levels with law enforcement in an open forum meeting. I'm happy to ask the agencies or to provide that information offline if you think that is necessary.
I think the crux of the question is if you had the information that you needed.
Yes.
When your team, that's what's important.
Yes, we had the information that we needed. I think the staffing levels were appropriate. I'm sure everybody knows my background. I was a police officer, lieutenant with Kent PD. I worked a lot of 4th of July incidents or events. And based on what I saw, I felt the staffing throughout the county was appropriate. There were no requests or denials by any department for additional PD resources. We were in communication with NYSEG, not New York State DOT, but I was in communication with our Commissioner of DPW, Tom Feary, during the storm. He assured me that the roads were being treated, conditions on the roadways were being treated appropriately. So if there were trees down in wires, they were contacting NYSEG. If there were just trees down, they would remove them and get the roads open as soon as possible. He indicated to me that there was no significant infrastructure damage or conditions that would warrant any additional resources outside of what our county DPW can handle. The next item is IT or equipment issues. Please advise if the Bureau IT equipment issues failed, or if there were any equipment issue failures on the evening of July 4th. So I can tell you that there were no equipment failures whatsoever on the evening of July 4th. We did have an internet failure on the morning of July 5th at approximately 6 in the morning. So I have a report here from Tom Lannon, our Director of IT Services, that would describe the incident and the actions taken to resolve it. So this is from Tom Lannon, Director of IT Services, regarding the July 4th through 7th, 2026 storm event. It's the Information Technology Operations Summary. Storm overview. On July 4th, 2026, Putnam County experienced a fast-moving but isolated severe thunderstorm. The impacts were regional rather than county-wide, primarily affecting portions of the town of Carmel, much of the town of Southeast, and the town of Patterson, including the Putnam Lake area. The storm produced heavy rain, frequent lightning, and damaging straight-line winds. Based upon the pattern of damage observed, portions of the storm likely contained downbursts, also known as downdrafts. I'm not a weather guy, so I don't really know what the terminology there means, but we'll go with it. I guess he explains here, a downburst occurs when rapidly descending air from within a thunderstorm strikes the ground and spreads outward at high speed, often producing wind damage comparable to that of a weak tornado. These intense localized winds can snap trees, damage utility poles, and bring down overhead utility infrastructure. Initial assessments following the storm did not reveal any significant interruptions to county information technology services, including the county network, internet connectivity, or telephone systems. At approximately 5:45 a.m. on Sunday, July 5th, a fire involving damaged electrical power lines along Route 311 in Patterson caused extensive damage to overhead fiber optic cables owned by Crown Castle. The fire resulted from electrical lines that had become entangled with fallen trees and storm debris. As a result, multiple fiber optic cables were destroyed, causing the county's primary internet connection to fail. The county's internal fiber network is designed with resiliency through a redundant loop connecting the Carmel and Patterson campuses. Under normal circumstances, if one section of the loop is damaged, network traffic automatically reroutes in the opposite direction, allowing communications between county facilities to continue uninterrupted. The exception is the Kern campus, which is served by a folded loop extending along Route 22. Unfortunately, that portion of the network was also impacted during this incident. While the county's internal fiber network remained largely operational through its redundant design, internet connectivity depends upon fiber circuits that extend beyond the county-owned infrastructure. Normally, internet service is provided through geographically diverse redundant paths entering the county from both Connecticut and Poughkeepsie. Due to the extraordinary extent of the damage outside the protected county loop, neither upstream path was available to deliver internet service into the county network. When internet connectivity was lost, the 911 Communications Center automatically transitioned dispatcher workstations to a dedicated backup internet connection. This automatic failover is limited to dispatcher workstations and ensures the continuity of emergency call-taking operations. At approximately 6 a.m., Communications Center personnel notified IT staff that network and internet issues were occurring. A county IT technician was dispatched immediately and arrived on site at approximately 6:20 a.m., so roughly 20 minutes after being notified, which is an outstanding job in my opinion. Initial troubleshooting confirmed the county's primary internet connection had failed. Internal network alarms were reporting errors associated with fiber outage. Backup internet service had successfully activated for dispatch operations, although one workstation required additional troubleshooting. Internet connectivity for county servers and enterprise services is intentionally not configured for automatic failover. This design prevents unintended routing changes and allows staff to verify the integrity and security of critical systems before redirecting traffic. County IT staff manually transitioned those services that could safely operate through the backup internet connection. Although core public safety operations remain functional, several internet-dependent systems required additional intervention. In particular, I Am Responding, which distributes fire and EMS incident notifications via text messaging and mobile applications, was initially unavailable. After contacting the vendor, it was determined that the county's temporary backup internet connection presented a different public IP address. The vendor updated their security configuration by whitelisting the new IP address, restoring service. This behavior was expected given the application's security controls. Police mobile computer-aided dispatch terminals communicate through secure Verizon VPN connections. Changing the external IP address associated with these connections requires coordination among multiple Verizon engineering groups, as well as configuration changes within county systems. Because restoration of the primary internet service appeared imminent at several points during the incident, this lengthy reconfiguration process was intentionally deferred. There's another system called the Fire Rescue System utilized by the Brewster Fire Department that was also affected, in addition to the I Am Responding system. It should be noted that FRS is not a county-operated or county-supported application, but rather a system independently purchased and maintained by the Brewster Fire Department. County troubleshooting confirmed that incident notifications were successfully being transmitted toward the FRS servers. When contacted, FRS technical support was unable to resolve the issue and indicated that the company owner would need to return the call. No follow-up assistance was received during the outage. Throughout the incident, County IT remained in regular communication with Crown Castle, the owner of the damaged fiber infrastructure. Multiple estimated restoration times were provided throughout the event, but were repeatedly extended. The primary cause of the delay was that the damaged fiber cables were intertwined with energized electrical infrastructure. Repair crews could not safely begin restoration until NICEAG declared the area safe to enter. As repairs progressed, additional sections of damaged cables were discovered beyond the original damaged locations, requiring continued reconstruction and resulting in revised completion estimates. Sorry. I know this is lengthy. We're almost through it. Full internet service was restored at approximately 6:40 a.m. on Monday, July 7th. It goes on for public safety communications. It is important to emphasize that at no time during this incident were county radio communications compromised. The county's Project 25 or P25 radio system remained fully operational throughout the entire event. Fire, EMS, law enforcement, and county agencies continued to communicate using the county radio system without interruption. This event also serves as an important reminder regarding emergency notification methods. The primary dispatch method for fire and EMS remains radio paging. Many responders have increasingly chosen to rely on smartphone applications for incident notification rather than carrying or monitoring their issued pagers, much like the ones we carry every day. While the applications provide valuable convenience, they should not be viewed they should be viewed only as supplemental notification tools and not as a replacement for radio paging. So what he's referring to there is I Am Responding and the FRS system that notifies people via cell phone service, essentially, instead of radio communications through the pager. Application-based notification depends upon numerous independent systems functioning simultaneously, including commercial internet connectivity, cellular carrier networks, tower availability, smartphone hardware, smartphone operating systems, mobile applications, application vendor infrastructure, cloud hosting services, VPN and network routing, public IP address accessibility, third-party authentication services, device battery life, and user notification settings. A failure in any one of these components can delay or prevent notification delivery. By contrast, the county's public safety radio system is engineered specifically for mission-critical communications and remained operational throughout this incident.
Commissioner, if I could just ask you, as far as the reading of the report from the IT director, if you would pause that portion just to give your last 2 cents there. You've given a tremendous amount of information asked upon you here tonight. Appreciate all of that. And the delve into the IT question is a rabbit hole that could take us till Monday. But appreciating all of that. Sure. But just your 2 cents on where we wrap on our questions here.
So he has just a one paragraph summary. Would you like me to continue with that, or
whatever you feel is best?
So I'll read the summary because it's quick. The July 4th storm demonstrated the resiliency of the county's internal network design and the reliability of its public safety radio communications infrastructure. Although there was damage beyond the county-owned infrastructure, resulting in a prolonged internet outage, county IT staff responded immediately, implemented available contingency measures, coordinated with affected vendors, and maintained essential public safety operations until service was fully restored. The event also reinforced an important operational principle. While internet-based applications provide valuable supplemental capabilities, the county's mission-critical communications continue to rely on dedicated public safety radio infrastructure as the primary and most reliable means of dispatch and emergency communications. And that concludes the report from our IT director. I know this is lengthy. I'm trying to get through all the topics of concern as quickly as we can. It basically then goes on to other. Please advise of any other observations you have or lessons learned that would assist in areas of where the county can better prepare for future events. So, as I said, anytime we have a storm, usually of a little bit more magnitude than this, we do an after-action review to identify any deficiencies, where we could do better, where we did well, and we kind of guide our actions based on that. In this case, I think from what I was told from my emergency manager, there was a little bit of lack of communication from some of our public utility companies. There was a delay in messaging getting out to the public about dry ice being available or bottled water being available, not through any fault of the bureaus, but because we didn't have that information available to us. So we've taken steps to speak with our utility providers to increase our communications so that for future events of this nature, we can get information out to the public in a more timely manner. After the incident was over, the town of Carmel made a request to the Bureau. They lost power for their police department and their town hall. So they contacted the Bureau, and we sent them a generator that was capable of running their entire facility, which they still have on site. They're not utilizing the generator at this point because power has been restored, but it is on location until they get a replacement generator. In the event that they do suffer another power failure, they will have operational capabilities. So we do learn things from storms like this and for after-action reviews. And, you know, as I said, I'm happy to provide any information that you as a legislative group are looking for. And thankfully, in this case, there were no major injuries or no major damage in the form of, you know, infrastructure or buildings or anything of that nature occurring as a result of the storm. And it gives me the opportunity to commend my staff for doing what I think is a great job.
Great. Thank you so much, Commissioner.
Sorry it was so long-winded. There was a
Well,
lot of topic.
it was a quick storm, but a long story, right? So thank you so much for all the information, and just a quick one or two items that I will look to converse with you. So, and now with the addition of Deputy Drew and his experience, he might see things differently on this, and I would suggest, but defer to experts, in terms of having the men in quarters is something that we're always happy to do anyway, and mostly start going that way. And one of the things would happen then, that requires less of your staff, right? So once you dispatch a particular department, instead of having to do the 2-3 sets of tones, if you already know that those guys are there, it could make things better in a bad situation. And you have to be crazy to walk through the door of a firehouse anyway. So once you guys make that call, the guys are coming. I'll defer to more expertise, but in a situation like that, it could actually lighten the load of the dispatchers, not having to go and look back, are we out there? So suggestion, and then we'll see with that. Now, while not directly reporting to you, I have somewhat differing information pertaining to NYSEG's cooperation and communication with our DPW and other departments, and we strike a fine line there, right? Because NYSEG is a public service company, but we also need them to help us. We need them to respond to our calls or provide water and dry ice in situations that come up like that. Activation of the EOC would provide us with that NYSEG person right there. But you're right, there's 38 other seats that we don't maybe necessarily need filled. So like many parts of this story and the conversations that I've had with Director Lannon afterwards, the more I learn, you see what's going on behind the scenes is that 98% of the things went right? So it's easy to pick out the 2% or 3% that either went wrong or say we could do better and scream about that. But also when we look back at this and we say, okay, that went right, the details indicate that a lot of things and the millions and millions of dollars were spent before you and I, the three of us were ever in these positions exactly for those reasons, were money well spent with our center and with our backups. Not under your purview. The loop conversation with Director Lan and I, we don't see that the same way. To me, a loop is a circle. So one particular fire on 311 that went through multiple cables did in fact sever a loop, right? But if those loops are on the same pole line, you don't actually have true diversity at that particular point. But the entanglement, the electrolysis of the trees and everything else that happen with that become very complicated. We saw ourselves, we have a number of people, residents ourselves, in front of their house will be a cracked pole that goes through the primary, secondaries, and communications. And then they're complaining, why isn't my power on? And you're looking right in front of you at all this disaster. It's not easy to plant the pole and remount all those cables and make sure everybody can do that safely. So NYSEG and the communication is obviously not directly under your purview, but I've heard conflicting stories about how communicative they were. However, I can report to you the other side of the story. I saw NYSEG crews that night move at the direction of your staff and the direction of the chiefs. Priority, move here. Priority, move here. Report of wires down in the car. Are there people trapped inside? No. Okay, that's not a priority. So the crews who were already in and working for NYSEG seemed like they went above and beyond in helping you, us, all the residents of Putnam, but maybe some of the management and other issues, we can get into that offline. It's a different issue, right?
So on that topic, NYSEG did a phenomenal job with responding to events during the emergency. They prioritized what calls needed to be addressed immediately and what ones could wait until the day after or the subsequent days to follow. They had very good communications with our 911 center, and I did have text communications with the person that would have been in our EOC had we activated it. So I didn't mean to say that NYSEG didn't respond during the emergency as they should have, because they did a great job with their response when needed during the emergency. In fact, they dealt continuously the following day and the day after with our emergency manager to identify what locations were critical in nature that needed to be restored sooner rather than later. So their response in that regards was fantastic, in my opinion. The only real downside or takeaway was regarding the information about the day after providing dry ice and water and things of that nature, which is probably or definitely less important or less critical as to the operations during the storm.
Right. And we saw that some of the other counties, whether it was Central Hudson or NYSEG working or Con Edison, they did outperform us in getting that dry ice and water out to the community and getting that information out as to where it is. And maybe that's something we look into in the future as being better prepared instead of counting on NYSEG or not. I'm not 100% sure. And then one other thing, an observation of mine was what has been now communicated, I think, a couple of times in conversations that I have and serves us all well to get that out to the department is what Director Lannon and you've been talking about, that radio is the primary. And I admit myself, never even occurred to me. With all the other ways that communication has been established over the last couple of years, I've had to do several updates and several programs myself. Never occurred to me that that's still the primary source of information that we're supposed to be utilizing because, and you can appreciate this, when you receive orders, chief orders, SOG, when a call comes in, here's what I want you to do. And those SOGs indicate using those apps, indicating you're responding on what equipment, where you're going, which station house you're going to. So you develop the mentality that, well, my primary responsibility is to make sure I acknowledge on that piece of technology who's coming and where they're going. So, but for the county's purposes, I think it serves us all well to get that message out like we've been doing, that the paging system, which did not fail one iota during the storm, is the primary form of communication.
So that is also an important takeaway from the storm. The Bureau reiterating the fact that the radio system is the primary form of paging out emergency services. It's very convenient for people to carry their cell phone and not have to carry around a pager, but the potential to miss being activated for a call is significant versus very low for using the radio system. In fact, I believe the chief of the Brewster Fire Department sent out that same message to his staff subsequent post-storm that, yes, the radio system and pagers are our primary means of notification. I am responding, cell phones, text messaging, that kind of thing is secondary, meant to be a backup or a supplement.
I think it serves us all well the more that message gets recommunicated throughout all the departments throughout the county in circumstances like this. So thank you so much. Call upon my colleagues with any questions.
Sure.
Anasio, let us see.
Not a
Montgomery?
question, just, thank you for that thorough debriefing on the storm. I've never had that before here. It's much appreciated. Just want to say, don't forget about Central Hudson. I know you did mention it at the end. It's a critical part. I've seen great improvements in their response. We didn't get hit as hard as you guys did on the west side of the county, but I am so interested, and I know you do it extensively in training, and I think at some point, maybe before budget season, I'd love to have this kind of forum to talk about training, because if there's one thing I can't stress enough is the importance for even us as elected officials, what's available to us through NIMS training. I have level 100, 700, 400. I sat in a room for, imagine, a whole weekend, 4 days with FJ Spinelli. So it goes, I have the level that a fire chief would have in a way for emergency response. I went down to Emmitsburg, Virginia. There's a great resource, the Emergency EMI Institute down in Emmitsburg, Virginia. It's a wonderful resource. Maybe we want to think about as elected officials, instead of going to NISAC one year, which is a great resource too, but it tends to be much the same, is attending the EMI Institute instead of going to NISAC as part of our training. But again, NIMS is available for not-for-profit organizations, and how do you get your organization to respond in an emergency? And if I can help, the Bureau, advocate for that throughout the community, I'd be happy to.
Appreciate that.
Thank you.
So a lot was said about NISAG because most of the customers that were affected were on the eastern side of the county. Our contact at Central Hudson did reach out to me during the storm and said, if you're activating the EOC, let me know. I will make myself available and I will respond. And they did respond accordingly to the needs of the people on the western side as well. It just wasn't as severe over there as it was on the eastern side.
They've learned a lot.
But not to neglect it or think that
No,
they weren't there or doing
I
what
was
they were
gearing
supposed
that
to.
toward Tommy and his questions.
Well, and then it's one of the difficult things that comes up with any power outages, whether it's Central Hudson and ISIC, whatever, is that when there are 1,800 outages on the board, the people who keep calling, what is important, I'm so happy to hear that. What's important is you and your team making those decisions or communicating that, say, you might have 1,800 reports, but here are the 5 that I need you to prioritize. I believe you guys already have that information, right? So it's important to hear, I'm glad to hear that somebody's answering your call when you say these are the sites that we need to get back on. Thank you so much. Any other questions from the committee? Chair recognizes Legislator Crowley.
Thank you, Legislator Regan. I just wanted to touch on 2 parts. So I know that NISAG was dealing with 80-mile-an-hour winds at some parts, and I did speak to somebody from NISAG, probably the same person you spoke to, and they were dealing with acuity and trying to do what was best, but also making sure people were safe at the same time. So I'm very thankful that they were very easy to reach and talking to everybody. My second question is with the looping system. So now that we have communication set up at the Sheriff's Department, I guess this is a 2-part question. When their IT or their Wi-Fi went out, does that, if you guys went to, let's say your Wi-Fi was down and you had to go to their communication system and use them, is it set up so that the secondary will back up there and they'll be up and running?
So I'm not sure I understand your question.
So when
the
they
backup now-
they lost
I think I can
Wi-Fi, right?
answer. I think
That might be Director
Okay.
Lannon too, in all
Okay.
fairness.
it would be an IT question ultimately, but I believe they're on the same county network and they operate the same networks that we operate off of. So if we're out of service, they are also out of service. Barring if it's something in a connection from the loop or the feed, as we say, to our building specifically.
But it's my understanding that the Sheriff's Department internet outage, which is an isolated incident, was unrelated to 311 and everything else that you were dealing with.
That I'm not sure about. What
That was, yeah, okay. Well, we
as far
can,
as it being
I guess I was
isolated.
just asking as like a secondary backup, to make sure in a storm, God forbid, we had the Carmel Police Department go down, right? So you guys absorb those calls. If you guys went down, then next would be the Sheriff's Department. Are they set up to have, the right communications, the right backup if God forbid that happened? Because they did just get the communications system, or Sheriff has just to bring up communications again. and get it revamped. So I guess that's a question for Director Lannon, but to make sure that you guys are covered if you need to use it for a secondary.
Sure. So our backup 911 center is located at the sheriff's office.
Right.
So we routinely send people over there to check to make sure that the systems that are at the sheriff's office, which are essentially the same as the ones at the 911 center, operate effectively and efficiently. So I don't know as far as the technical details as if we went down, because they're in close proximity to us, whether they would go down also. But we also have redundancy, right? So
Right.
we have a backup network for the county, which we ended up using in this case. And we also have a backup wireless. So in the event that the county networks were down completely, the 911 center and the EOC, just recently this year, we purchased the capability of going wireless through cellular providers without having to be a wired infrastructure type setting. So if the wires are compromised, we can still operate on the internet level. And again, that's a completely separate system from the radio system. So our radio system is robust, and there are many backups and fail-safes to make sure that we don't lose radio communications. So that's priority. The cell phones and stuff and the internet and paging and messaging is kind of secondary.
Nope, just
We'd
want to
like to
make
see-
sure
we'd like to see 'em
everybody
both
has
work all the
exactly,
time,
right,
but, you
exactly
know,
what they need,
yeah.
that they both, if one becomes interrupted, that the other can kind of pick up where they're left off and, back each other up. But it sounds like
Yep.
you guys are in good working condition, and so I'm glad to see it up and running there, and that you guys were able to make it through the storm. Thank you for all your hard work and hours you put on the 4th of July. And I also think my last part is I did have a call with NYSEG talking about the future with some of the widowmakers that are out there, that they need to have their arborists come out, take down, remove some of the poles that when they put up new poles during storms, they tend to leave the old ones. And when you have running water that has now changed paths because of whether it's trees that have been taken down or houses built or whatever, it may take them with them. So we did have a conversation about getting out there, removing the widowmakers, and also removing the poles that are nicely marked with their emblems on it, and getting them out of the way so they don't cause more damage than we need to.
That is important.
What they call double woods is a hot button item with the Public Service Commission. They're usually timed on that too. You're only supposed to be able to have a double wood there for a temporary period of time, but
Unfortunately, that's
Oh, I'm
not
sure
the
it goes
case.
by
So
the wayside
I
with the-
did,
yep.
I did have a nice conversation about that, and I think it would alleviate some of the problems in the future to make sure that, like I said, the widowmakers, there were a lot of trees that should have been taken down that caused problems. So
So one last question on your request, Mr. Chairman. It says additionally, I request that a written response to the legislature be provided. I haven't had the opportunity to put all this in writing in report form as of yet.
I think you
Is-
did with your phenomenal testimony tonight. It's
So-
all been transcribed right there.
My question was
So-
just whether or
Yes.
not we needed to respond in writing in memo form.
No, thank you so much for your testimony here tonight. I think you've answered a lot of questions. Chair recognizes Legislator Russo.
Thank you. I want to thank your team, the entire emergency services, the sheriff's department, all the volunteer firemen that were out there. I happened to be in Mayapack as the storm came in. We didn't get a text until a while later. Making my way across, halfway across the county back to Patterson, there was a lot of trees, and I just think NYSEG, for once, was responsive, handled all the priorities. Your guys and, all the other teams were out there. I know my fire department handled multiple fires that weekend. They actually called me to get the delivery of the dry ice because all the guys were out on the road. So I thank everybody that was involved and giving up their holiday weekend. Thankful that it wasn't that huge of a storm, but, thank you guys.
Thank you.
Thank you, Legislator. That was one oddity I'll communicate. I don't know if you guys are aware of that. Putnam was sort of second or red-headed stepchild treated that way, which was go pick it up. We got that in the Southeast, and apparently you had that too. Whereas in some other counties, the ice and water was staged by Central Hudson. Come and get it. Here's where it is. We got the call. Sounds like you did too. Come and get it if you want it, which
No, actually, ours was delivered to the fire department. but there was nobody there to disperse it because there was a couple guys in the command center, but most of the guys were out on trucks handling multiple fires.
But I'm interested. So you're saying NYSEG brought it to your firehouse?
I think.
We had to go get it. Southeast has to go get it, which was unrelated to the fire department. We just brought it to the FD as a staging area. But NYSEG had called us and said, come and get it if you want it. Which we get, right? We want them out there clearing roads and cutting down trees. So thank you, gentlemen, for for responding to this inquiry and for the services that you provide protecting the residents of this county. I appreciate it.
Thank you.
Okay. Any public comment pertaining to the testimony from Commissioner Oster? Seeing that there's none, we'll move on to our next item, which is approval for a grant application from the Bureau of Emergency Services for Emergency Management Performance Grant Program.
See, I'm not done yet.
Stay there. We used to go.
You got a deputy. He can take a ground ball here.
I got it. So we're looking for approval, and again, both of these grant requests are unique circumstances because the deadline has already passed where the application was due. So the grants have been submitted, but we'd like approval from the legislature to continue to pursue the monies available in these grants. The first one is the EMPG performance grant, which is Emergency Management Performance Grant. That's a grant of $35,530 that's available to the county. It does require an equal match of $35,530, but in this case, it would go toward paying partial salary of the Director of Emergency Management. So part of the requirement of getting that money available to pay that salary is for the emergency manager to have completed a series of classes similar to what Ms. Montgomery had referred to in NIMS training and ICS training, which we are fortunate that the person we hired to be our emergency manager had already completed. So since we're paying his salary anyway, it's really a no fiscal impact other than a gain of $35,530 to the county. So essentially we have to match, but we're paying the salary anyway, so it's a win for us.
So, Commissioner, to the extent that's possible, because the legislature gets many requests similar in nature like this, and it's something on a grand scale we're looking at. And you'll see yours. So we have the one-page cover letter right there, right, which gives the title of the request and 25 pages of the document itself, not necessarily filled out. It's the application. It's the what is the grant. So in circumstances like this, and because we had so much to do, we didn't send it back asking, and thankfully you're here tonight, but in the future with the request, if something of that nature can be added to the memo, which explained exactly, we're looking to get $35,000 and this is what we plan on doing with it, it would be appreciated. We didn't send that back this month because it was already enough on the plate. But the 25 pages of the application itself, I'll do my best to read it, but it still doesn't tell me what you're going to do with the money once we get it, right? And the matching funds. So, any other questions from my
Yeah, with that,
colleagues?
I can easily access these online. And what I would like to see, and I've asked for this before, not to you, but just the executive summary that you submit with the grant would be really helpful. And I understand you've submitted this already, but with that, I have a difficult question to ask because I did read the application. Just call me a geek. And while I see that we're using it primarily for salaries, we did just allocate funding out of the general budget to do a COOP plan. And I see in this grant application, an allowable use is exactly what the COOP plan does. So my question is this: before we write the check out of the general fund for the COOP plan, can we use this funding to pay our consultant?
So I would have to research that to find out if we could use the grant funding to pay the consultant, but then we would lose the grant funding to pay the salary. So either way, you're getting the same amount of money coming into the county.
But we've
whether you
already
spend it.
budgeted for somebody's salary, and we've already budgeted for somebody's training. So I'm not understanding this. We've already budgeted for the salary of this person We've already budgeted, this is a windfall of money that we're applying for and we're going to get.
Is that a
So-
finance question? No, so in that scenario, say somebody's salary is $100,000 and we get a $50,000 grant
And then we decide not to
from the state of
use
New
what
York.
we budgeted for, that the public's aware of, that we taxed them for, and we're using the grant instead. Ooh.
That's a direct
So
finance
just
question.
something to look at. If we could consider that before, let's say, you know, I know you've applied for this grant. You haven't been awarded it yet, correct? Or have you been?
We
It's like-
will, it's essentially predetermined, so
Yeah.
if we apply,
It's every year.
as long as we fit the parameters, which we would get that amount of
Mhm.
money.
I just, back when we were talking about the COOP plan, I just really didn't want, obviously, you heard my statements about that. It's not that I didn't want to do the plan, but I know there are resources to fund that plan. And if we can use this, what I don't understand, and this is more of a finance question, an administrative question with the executive's office, is we've funded this position. We've funded training, actually. We have that. It's that there's budget lines all throughout your budget. So now we
So-
just took money out of our general fund to fund the COOP plan.
So to me, it's the same impact to the county's overall budget. Typically, the EMPG grant is awarded on an annual basis, and we use it every year to pay toward salaries of emergency management staff. The COOP plan would be a single incident, in my opinion, where we pay a consultant one time. So the money could potentially be used for that if it says that in the grant process. But it results in the same fiscal impact, in my opinion, to the county, and then the following year, we would go right back to utilizing it for the salary anyway.
Mm-hmm.
So I'm not sure what the need to change the parameters of what we normally use the grant for to be applied to the COOP.
So I
cost.
guess then what's not clear during budget season and the personnel part of the budget is we don't know exactly that position is going to be funded with a grant. Sometimes we're aware of it, but we funded it knowing it was coming out of the general fund.
Is there a question
No,
there?
just a statement.
The grant is not guaranteed, right? So we have to fund it. We have to show the backing, the financial backing, I would imagine. If the grant comes in, then
I don't
we're-
know. It goes to a different topic.
Legislator Anisio, any questions pertaining to this grant application? Other legislators? Chair recognizes Legislator Crowley.
Thank you. So the COOP plan, I mean, we get this every year. Like Legislator Montgomery said, but the COOP plan does have return on investment, as we've discussed before. It gives us opportunities for other grants as we, get it up and running and have different departments being trained. It gives us opportunities for so much more. Like I said, I think I gave numbers on what Dutchess County brought in with their COOP plan. So I think at $10,000 we've allocated for this gives us and the people of Putnam County such a huge return if we use it and allocate the funds properly, and opens up the horizons for so many more grants for other departments. We've seen money go out for much more money go out for much less things, and this is about emergency preparedness. So I don't think the COOP plan, I've stood by it for 2 years now, and I think it's shown its worth. But I appreciate you always preparing these grants. They're not easy, and they're definitely something that we need. It takes the burden off the taxpayers, and it distributes them to allow us to have other positions or different devices or different utilities that maybe a small county like Putnam wouldn't necessarily be available to. So thank you to, all our emergency services for continuing to write these.
Any other legislators? Nothing? Chair recognizes
Sure.
Legislator
Yeah,
Montgomery.
I think Legislator Crowley misunderstood my question. My question wasn't referring to doing away with the COOP plan or that we shouldn't fund the COOP plan. We've already decided that we will. What we didn't know during that process of funding the COOP plan was that this money was available for that. And we took the money out of the general fund.
I would have to check the dates as far as when the grant was announced to even be able to verify that the grant funding was available prior to us asking for money to fund the COOP project. So I'm not sure if the dates coincide with when the request for COOP was made versus when the grant announcement was.
Okay. Heard from all legislators. Anybody from the public on this particular grant application? Seeing that there's none, I make a motion for approval to authorize the grant application. Can I get a second?
Second.
All in favor?
Aye.
Aye.
So carried. Okay, up to item 9, we have approval for a no-match grant application, also from the Bureau of Emergency Services for the State Homeland Security Program grant. And I think,
So this grant is, as you said, a no-match grant. The amount of the award would be $147,348, and this is for the State Homeland Security Program grant, or what we call SHIP. Part of this grant has a law enforcement terrorism prevention requirement. 35% of the grant amount is required to be utilized for that purpose. So we are working closely with the Sheriff's Office. We have worked closely with the Sheriff's Office to identify law enforcement terrorism prevention needs from their agency, so that we can meet the grant requirement. In addition to that, there's a component for election security that will also be met. So essentially, the 35% amounts to a number of $51,572 that will be spent on terrorism prevention, and the remaining $95,776 to be spent on equipment and needs of the other emergency services throughout the county.
That's broken up
any
into
questions from
one-third,
the
right?
committee?
1/3 each.
Any questions?
Well, when
Chair
we,
recognizes Legislator Montgomery.
thank you, obviously, we don't have an itemized list of what that other equipment is yet, but you'll come to us with each item.
I can
And
give you an itemized list right now if you'd like.
how long is it?
How long do you want to be here? I
So-
can give you the short version.
Sure. Just to give me an idea
So-
of what we're buying here.
We're looking for the fire service and for emergency management to purchase SCBAs, which are self-contained breathing apparatus devices, to replace aging ones that are being utilized by our hazmat team at the moment. We expect that those older devices, some of them are more than 20 years old, will no longer be in service within the next year or so. So we're trying to budget to replace a small portion of them each year as we move forward, so that we can get those guys utilizing safe equipment so that they can breathe. Another part of the project is for satellite phones for emergency management. Again, it's a redundancy thing. If we were to experience a catastrophic event at our building in the sheriff's office and had no 911 center available to us, we feel it's important that the essential people in emergency services can still communicate. So we would intend to purchase some satellite phones to be distributed to the Sheriff's Department, Bureau of Emergency Services, 911, DPW, the county executive, people that we feel that would be the basic bones of keeping county government and emergency services operating in the event that we lost all other means of communication. And the last item that we have on our list here for the grant is a gateway for portable radios. There's a significant issue in Putnam with communications, especially with fireground radios. They're not able to communicate with each other. Some departments haven't had the funding available to purchase radios that can communicate on the county's fireground channels. So this device would allow us to patch together legacy radios that are just utilized by one fire department with the county's fireground channels, so that everybody could communicate on a fire scene together. Along those lines, you can expect to hear from me in regards to
Those
a
budgetary.
request for additional communications enhancements. I really think we need a communications vehicle in this county, but it is a big ticket item, and it's not covered under most, if any, grants that I'm aware of at the moment. So that'll be for future discussion. But communications is key to the success, the safe operations on any incident, and for a successful outcome. So we feel that that's money well spent.
just as an example. So tremendous explanation. None of that was given to us with the 27-page booklet, but
I understand
thank
where
you
you're
so
going.
much.
Yep.
All right, I think we recognize the committee here with
I
any,
didn't know you didn't.
Oh.
You didn't recognize me.
I did?
You didn't. Would you like to?
Absolutely. Chair recognizes
Oh, thank you.
Legislator
Thank you so
Amnesia.
much.
Mr. Chair, honorable.
Yes, thank you. No, thank you for the explanation. I'm absolutely in favor of this. This grant is very, very important. As you had stated, we're replacing outdated equipment, which is absolutely important, and the portable radios. So, and the other wonderful thing about this grant is it's non-matching. So no match required for $100,000. Thank you for all your work, hard work.
Appreciate it.
Thank you. Any other legislators? Any questions? Anybody from the public on this particular item? Seeing that there's none, I will make a motion for approval of the no match grant application, Bureau of Emergency Services, to the State Homeland Security Program grant. Can I get a second?
Second.
All in favor? Aye. So carried. Item number 10.
Thank you.
Thank you.
Thank you.
Thanks so much, guys.
Thank you.
Thanks.
Item number 10 is approval for a no match grant application to Sheriff's Office, United States Department of Justice, COPS, Community Policing Development Micro Grant Program. Item number 10. Welcome, Sheriff.
Come on down.
Good evening. How is everyone?
How are you?
Good.
Good
Welcome.
evening. How are you?
It's a long stretch tonight.
Yeah.
You're really testing my
And
patience.
Protective Service, this is first. Protective Services is first, right? I counted that though, Sheriff. I'd say that everything we heard here tonight was phenomenal. I love the reports that we got from the various departments.
I hope I can keep it up for you.
Some great work
You
being
want to
done
be
here.
on first.
I guess I have 10 items tonight, so I guess I'll be here for a little bit.
Okay,
So-
so we have an approval. Go ahead, sir.
So the micro grant is a new grant we have never applied for before. Department of Justice COPS micro grant. So a micro grant had 10 possible choices of what we could put in for. We've decided on a drone as a first responder to continue our project, which I'm hoping to put through the 2027 budget. This will allow approximately $200,000 to expand that project into the Hudson River, is our thought. That's one place that's lacking right now. So we'd be looking to put a dock somewhere in Cold Spring, Garrison area and be able to cover a majority of the Hudson River with a drone to assist with any marine assets. And I don't have a copy of the application. It is completed. I could send it to you if you'd like to read it over.
Well, thank you, because, and if you don't mind, photocopy it to Commissioner Oster. You've provided exactly what we're talking about here, which is a summary of what it is that Putnam County is going to do if and when we receive the grant, with the information that's provided in a memorandum sent over. Thank you. The grant applications come in fast and heavy, and we print all of them. They're all at least 25 pages, 2,000 pages printed all the time. But thank you. So you've
We had some time with this. I have the application there. It's not due until the end of August, so I can definitely send it to you if you want to
Okay.
review it.
any questions or comments from the committee?
Just a comment, how could I say no? Cold Spring Garrison, right?
That's why I put it there.
Yeah. So you don't want me to ask
I
any of
lined
my
it up.
questions,
Yeah.
right? I'll just put these
I'm
away.
going to get out here in 15 minutes, yeah.
Yeah, at this point, we're applying for the grant to see if we can get the funding for
Correct.
this.
To expand the project, I'm hoping to get through the legislature for 2027 budget. So this will
Right,
make
and
it
this
a little
is
bit
what-
larger.
You know, I did this. I did the trial run with this drone operation and saw its capabilities. Was really impressed. As you are probably aware, folks on my side of the county are concerned about policy related to these, retention of data related to not LPRs specifically right now, flock cameras. So, you know, I think we'll have to have that discussion at some point, but at this point, we're just applying for the grant, and I'm
Correct.
fully
And we
in
could-
favor of it. And again, I saw the capabilities. He let me operate it. It's
And it comes with a transparency portal, so when we come to have our budget discussions, we can go through all of that, and I'll have a presentation for you.
great. And we'll have we already have a policy that exists for drones? Would that be the same policy?
It'll be a different policy
Yeah.
because those are manned drones. This will be a unmanned, kind of a beyond visual line of sight is what they call it. So it'll be our remote pilot. So we'll have to come up with a new policy for these.
It's going to have a fixed location with a remote pilot, not the mobile ones we spoke about.
Correct.
Okay.
Yeah.
Thank you. We'll have lots of conversations, I'm sure.
I'm sure.
Any other questions? Okay. Chair recognizes Legislator Crowley.
I'm glad to see that we have someone back on the Hudson again, or maybe back on the Hudson again. We had beautiful boats, and unfortunately they got returned. So I'm glad that our county, and I'm thankful that you put into this grant. I think it's great that we'll have some sort of device, helping out the rescue teams over on the west side.
Right, so these will be used to assist the fire departments at this
Because
point.
right now, I think
Right.
that's all we have through the chair to, let's say, Montgomery to defer, right? You have two fire departments that respond,
We have four.
that respond on the water, but it was two. I
Wha-
could be wrong.
Yeah,
Yes.
yeah. But I mean, they would all respond at some point.
So it's a great thing to have. We have it, and we used to have an MOU with other counties too because of Indian Point, which I don't know if that still exists because it's decommissioned, but we did have some bridge authority there too. So I'm happy to see it. So luck, and I hope you get it.
Thank you.
Any other legislators? Any public comment on this item? Seeing none, I'm making a motion for approval of the Sheriff's Office, United States Department of Justice Community Policing Development Microgrant Program. Can I get a second?
Second.
All in favor? So carried. Item number 11 is approval on another no-match grant application, Sheriff's Office, New York State Division of Criminal Justice Services Law Enforcement Technology Grant Program. Again, with a nice little synopsis here. Thank you, Sheriff. So anything you want to add to what's already been submitted to the committee?
No, this is another grant that's not due until September, so I got this in early. So we're still trying to run through what kind of technology needs the office needs. So we do have a cap. The state put a cap on it this time for our size agency. The cap is $500,000. So I will try to spend every cent of that $500,000. And I will have a more itemized list as we get closer to the end of the grant period.
Any questions or comments from the committee?
Just a comment, just to prepare for the future, because you understand what the public is saying about all of this technology. And I think maybe it should happen here, but more importantly in the different communities. And maybe there's an opportunity to have some kind of forum at some point. I think it's face-to-face conversations, so education is key, so they understand.
However you want to do it, we
Yeah.
could do it here as, on the protective. If we could do a public forum, that's up to you.
Great.
I think we're in a much different place than Dutchess County even is. So I'm prepared to talk about it whenever you want.
Yeah, I think it would go a long way,
Sure.
and you would get less emails and phone calls. I think
We like them. We like the contact.
Okay, any other legislators for item number 11? Any public comment? Seeing that there is none, I'll make a motion for approval in the new match grant application, New York State Division of Criminal Justice Services Law Enforcement Technology Grant Program. Can I get a second?
Second.
All in favor?
Aye.
So carried. Item number 12 on our agenda is approval, Budgetary Amendment 26A055 from the Sheriff's Office, funds received from New York State Sheriff's Association for Dr. Dre training.
So one of our investigators goes up and teaches around the state, drug recognition expert training. So this is reimbursement for the costs that we incur during that.
Excellent.
Thank you.
Any
Thank
questions
him.
from the committee? Can I
Good
s-
for Putnam. To get us
Questions
out
from
there.
other legislators? Public comment? Seeing none, make a motion for approval, Budgetary Amendment 26A055. Can I get a second?
Second.
All in favor?
Aye.
So carried. Item number 13 is approval of a Budgetary Amendment 26A056 from the Sheriff's Office to reclassify revenue to correct funding streams.
Yes, I believe this is, you went back and forth with the Director of Finance. I believe this is just correcting budget lines. I believe this is more an administrative transfer than anything to do with the Sheriff's Office directly. I think there were some previous grant money was put in the wrong lines. So I think this is just correcting that.
Okay.
Just housekeeping.
Housekeeping.
Housekeeping, yeah,
Housekeeping,
exactly.
I like
Budgetary housekeeping. Any questions from the committee? Any questions from other legislators?
Expensive housekeeping,
Yeah.
but sure, no.
I think it's zero at the end of the day. I think it's just
Yeah.
moving stuff around.
Any
yeah.
public comment or questions on this particular item? Seeing none, I make a motion for approval of Budgetary Amendment 26A056, reclassify revenue to correct funding streams. Can I get a second?
Second.
All in favor?
Aye.
So carried. Item number 14 is approval, another budgetary amendment, 26A057, also involving the Sheriff's Office, insurance recoveries. Sheriff submitted an amendment, well, go ahead.
Yeah, I believe this was a motor
Amendment.
vehicle accident involving the corrections officer. Someone backed into their car while they're driving to the parking lot. So we're trying to recover $822 from State Farm Insurance. So we've gotten that money, and we would like to put it back in the bank.
Excellent. Any questions from the committee? Any questions from other legislators? Any comment or questions from the public? None on this item. Seeing none, I make a motion for approval of Budgetary Amendment 26A057. Can I get a second?
Second.
All in favor? Aye. So carried. Item number 15 is another budgetary amendment of 26A059. Also, the Sheriff's Office, recognition of funds received from U.S. Capitol Police. Item number 15.
Correct.
What do you got there, Sheriff?
So this was an MOA between us and the U.S. Capitol Police for a Lawler event at Mayapack High School where they reimbursed us for the overtime spent.
Excellent. Any questions from my colleagues on the committee?
Question, if I may, through the chair. Thanks.
Chair recognizes Legislator Montgomery.
I see that we're basically just funding at the rate, their regular hourly rate or their overtime rate. Was there an agreed upon rate established before the event? Is this the rate that's used across the board for every event?
It
Or
should
is
be.
it-
Yeah, there's a standard rate. I don't know it off
So
the
if we had
top of my
another
head.
federal officer in an event, it would be the same rate?
Correct. Yes, there was nothing, no discounts given.
Thanks. Good thing. That's happened before here.
I can imagine.
That's what she wanted to hear. Any questions from my colleague to my right?
No.
None? Okay. Any questions from other legislators? Any comments or questions from the public on this particular item? Seeing none, we'll make a motion for approval of Budgetary Amendment 26A059. Can I get a second?
Second.
All in favor? Aye. So carried. Item number 16 on our agenda is approval of the Budgetary Amendment of 26A062, also from the Sheriff's Office, recognition of funds received from the New York State Sheriff's Association. What do you got here, Sheriff?
This is the same explanation as the prior. This is a separate training course the investigator did, and we're just getting reimbursed for his expense.
Reimbursed by the state of New York?
The New York State Sheriff's Association is who funds this.
Nice. Okay. Any questions from my colleagues?
Nope.
Any questions, comments from other legislators? Any question or comments from the public? Seeing none, I'll make a motion for approval of Budgetary Amendment 26A062. Can I get a second?
Second.
All in favor?
Aye.
So carried. Item number 17, we have approval submitted of Budgetary Amendment 26A063. Also, the Sheriff's Office, use of federal seized assets fund to replace 2 motorcycles. Item number 17, fire it up there, Sheriff.
Correct. So this was actually it started as a budget request for 2027. I didn't think it was appropriate for the taxpayers to pay this, so I requested money out of the federal seized asset account instead. This is to replace two motorcycles. We have 2 2001s, and we have 1 2007. So the newest one is 20 years old. ABS, changes in technology. They're just not as safe as the new ones are. So I'm requesting to take this money out of the federal seized assets to replace those. And those 2 motorcycles will go to John Tully to be auctioned off or however the county deems fit to get rid of them.
Excellent. Any other questions from my colleagues on the committee? Any questions or comments from other legislators? Any question or comments from anybody in the public? Seeing there is none, I'll make a motion for approval of Budgetary Amendment 26A063, use of federal seized asset funds to replace 2 motorcycles. Can I get a second?
Second.
All in favor? Aye. So carried. Next item on our agenda, item number 18, is approval of Budgetary Amendment 26A064, legal aid, pass-through award from the New York State Division of Criminal Justice for aid to defense. I read this too. Anybody here to speak to this?
They're way understaffed, I'm sure. This is just,
Yep.
I can speak to it a little bit, but
You have some? Chair recognizes Legislator Crowley? Good. Chair.
it's just a pass-through in
Okay.
state aid for funding.
Pass-through for state aid and funding, okay? Any
Required to do this.
Any comments or questions from the committee? Any comments or questions from other legislators? Any comments or questions from anybody in the public? Seeing none, I'll make a motion for approval of Budgetary Amendment 26A064, pass-through award from New York State Division of Criminal Justice for aid to defense. Can I get a second?
Second.
All in favor?
Aye.
So carried. Item number 19 is approval of Budgetary Amendment from the Sheriff's Office, DASNY award to correctional facility for specialized inmate transportation vehicle. Item number 19. What do you got here, Sheriff?
So I have to thank Senator Harcum for a $100,000 grant to purchase a new corrections transportation vehicle. It's going to be a Chevy Suburban, and I believe a trailer to go with it. So that's all from the state. No taxpayer funds used, zero fiscal impact. So we'd like to thank him for that.
Based on what you're saying, that came out of the senator's personal funds? That's the way you said it.
He got us the funds. I don't know where he gets them from.
You said no tax. You said no tax dollars, Sheriff. That's our
Putnam tax
right.
dollars.
No
Right.
Putnam tax
State
dollars.
tax
Right?
dollars.
Hey, listen, if the senator's cutting out the checkbook, we're going to make a budgetary amendment. We're going
Anyone
to
who wants
take
to
it.
give us a vehicle, I will
Right?
receive it.
Okay.
That's great.
If I may.
Okay. So yes, Chair recognizes
No,
Legislator
I
Anizio.
just want to say thank you. I mean, this is wonderful.
Right.
$100,000.
Yes.
Okay.
Thanks.
Chair recognizes Legislator Montgomery.
Thanks, Senator Harcum. Yes, and I see in here there's a requirement that it has to be electric. I'm kidding.
I missed that page, I think.
Okay. Any comments or questions from other legislators? Any comments or questions from anybody in the public? Seeing that there's none, I'll make a motion for approval for the Sheriff's Office DASNY award to Correctional Facility for Specialized Inmate Transportation Vehicle. Can I get a second? All in favor? Aye. So carried. Item number 20, we have additional being submitted for number 20, which we all have to take note of the fact that it's confidential information. So I'll make a motion to accept the additional information for item number 20. Can I get a second? All in favor?
Aye.
Okay, so we have information being submitted to us. This is, what's that?
That you can't talk about.
That we can't talk about. I can read the item number 20, right?
I think we could talk. What my one worry was the pictures, because they do show confidential stuff, but we can, any of the texts available. It's just, these are live shots. I take it from the system, so I don't think we should release those.
Which is great, thank you, because we have a fund transfer that we do have to speak to, right? But the individual pictures will be kept confidential. So thank you, Sheriff. So item number 20, which is fund transfer request 26 T174, Sheriff's Office to purchase Mini-PCs to run Merlin core camera feeds. What do you got there,
So
sir?
this is kind of a longer story, so I'll try to do it as quick as possible, 'cause I know the health committee's meeting's next. Last year, we had purchased Axon Fusus. Axon Fusus was a mapping program much like this that will take in not only GPS feeds and all our vehicles and all our cameras and all these feeds, it'll also take in school and private cameras. So the officer in the field can have a single interface to look at all our school cameras, all of their partners, where all their vehicles are, all the CAD jobs. It's a one operational window. So the Axon contract was for $85,000. The problem was when we started to implement Axon, they didn't really live up to their expectations. So we ended up closing the contract through the law department. We ended up shutting down that contract, and we recovered that $85,000. We built this program. This is something I started in Westchester, Merlin. We added to this program that I had built in Westchester to add the school functionality into it, because that was the biggest push. But to do the next level, to get those cameras in the schools onto this map, we needed computers. So we took $20,000 of that $85,000. I'm asking you to move it so we could buy these Mini-PCs to put in all the school districts. We already have agreements with Brewster, Mayapack, Carmel, signed MOAs and went through the law department. We have cameras already in Mayapack and Brewster. So we're just waiting. We're trying to get these all done by September, school start. So this is the transfer of money to build those computers we have in the schools.
Purchase the computers or
Purchase the
build them?
computers,
Okay,
sorry.
all right. I'll go first because, but we still have many contracts with Axon, right? I've never
Correct.
heard.
This is a product they bought. Fusus was a subsidiary that they bought, and we thought it'd be easy because it'll integrate with everything else we already have, but
Yeah.
they didn't really live up to their expectations. They couldn't do the GPS on the cars. They couldn't do this, couldn't do that. So for $85,000 per year, we didn't think it was a good bargain anymore.
And you mentioned some vital information. So already the law department has canceled and recovered that contract?
Correct.
Okay, significant. Okay. Any other questions from my colleagues on the committee?
A lot. Yeah.
Hit me.
We have 20 schools. This will just be used for schools? We have 20 schools?
This will be used for schools. It's now, we put it in the county office building. We never had visibility at the cameras in the county office building until this program came along. Everything is siloed in the county, which I always thought was strange because even the building over at DSS, their cameras, we can't view from here right now. So this allows all the officers, supervisors, dispatchers are also going to have the ability.
So that explains the 20. I don't understand why the use of 20 separate.
I think we tried to
computers
figure out how many
for
we could do this year.
the feed. So the feeds need separate
So
computers.
each
feed.
separate network needs a separate computer.
And just we're buying them on Amazon. Like, is there any competitive?
I
like,
think
bidding process
that was the best deal the guys could find at the time. I think B&H was our original, but they would only sell us 5 computers. There's still a lot of shortages over this AI thing.
And does that include the license, the cybersecurity software, and
That's free because
the
it's
mount-
ours.
Okay, the mounting equipment that'll come with it.
So yeah, no. So the only
No
cost,
extra cost.
it's going to be our guys, the deputies from our office installing this. So they've got to go to schools, work with the school IT staff. We've already done it 2 places already, and get these on the network so we have visibility into them.
Okay, that's all I got.
Okay, that's easy.
So are we talking about something that looks like a server, Sheriff, or it actually looks like a desktop computer?
It
that
looks
would
like a
be-
desktop
so
computer.
a desktop computer placed out at the remote location, which then we can access.
Correct. So right now, let's say for the last couple of years, we had access to Brewster's school's cameras, but you had to carry, or someone had to have with them, the Brewster School laptop, a Brewster School user ID and password, and make sure when an incident happens at Brewster High School, let's hope that never happens, you'd have to have the right officer with the right equipment at the right place at the right time. This takes all the guesswork out of it. Everyone who's an authorized user can log in, can see the cameras, and the schools will decide which cameras we have visibility into. We don't record, it's only live, and it's just for school safety purposes.
Great.
Chair recognizes
Are
Senator
you
Anuncio.
done?
I'm
Are you-
done.
oh, no,
Thank you.
I know.
Yep.
Sheriff, I just wanted to ask you, what about private schools if they were wanted to?
And that's why
Jump
we
on
bought,
board.
that's why we bought 20, because I'm hoping some businesses, right, in vital locations where we want visibility, this will give us the ability of doing that, right? So we'll have to get an MOU or MOA or IMA, you name the contract. And then
An agreement.
once we get that ability, then we can put a device at that location and we'll have visibility on the cameras.
Do they have to reach out to you and ask you?
We're going to start doing reach out once
you
we're
are? Good.
online.
Oh, very
Yeah,
good.
we're trying to do the schools first. I'm trying to do a school push for September,
Mm-hmm.
and then we'll do a commercial push after that.
Do you have a list of all the private schools
this one.
in I can
I
get
don't
ours.
know if we have that. I'm trying to get all the list of all the businesses, which
Yeah.
is difficult enough.
It would be my priority if we did all the schools
Yes.
before the business.
As long as they agree. So
Yeah,
Ray, it's
right.
really what we went and offered it to them. All the public school districts agreed. And we're just waiting to get through the process with the school boards.
We'll-
Anyone who wants us to have it, we'll definitely give it to them.
Okay, I'm sorry, is there a cost
No.
for them? Okay, so you'll give it to them.
So we're so the only cost is the computers, which is what we're trying to transfer
Right,
the money
right,
for right
so
now.
that's fantastic. Okay.
Nancy will give you a copy of the yellow pages if you want a list of all the businesses.
Do they still have? I don't think they
No.
make that anymore.
I want the schools.
Chair recognizes Legislator Crowley.
I guess it's kind of a finance question.
Sure.
But we had moved a couple of years ago, $1 million that was for school safety and ARPA funds. We backfilled it, if we all remember that. And it was used for something else, and then we backfilled it, and I want to know if it's still sitting there, because technically this is school safety, and could we be using that line for this to pay for it? Right, and I don't know if
Finance.
it's a question for you, I think it's a question.
Finance.
Yes, I have third-hand knowledge. I don't.
I
need to-
kind was it for safety glass in the schools? Wasn't it for some? That's what I thought it was.
Because
No.
it ran out of time.
Okay,
And so we backfilled it and we used it for I think,
Something else.
paving or something else, but there
We'd
was a
have to find
line,
out.
And I'd like to look into if
I
it
was-
can be used.
I was told it was used for the radio project, is what I was told. But like I said, this is third-hand. This is before my time.
It's for the radio project, but I could be wrong, but I'd like to look into if it was, I'm pretty sure we backfilled it. And
I
then,
remember.
it would be nice to use it.
We'll have to
for
look that up.
but I do remember doing it.
Mhm.
And then secondary, are we developing a real-time crime north up here?
We develop. So I think I spoke to.
feel like it. That's not a bad thing. I'm just asking.
No, well, I think what's happened is I think we spoke about last time is we have nobody in the office. Somebody comes to the office after 4 o'clock, the doors are locked at the sheriff's office. We have to send the car back from Patterson or Southeast or Putt Lake to drive all the way back here to deal with whatever the situation is. So what we have is an SPO or a corrections officer now at the desk, taking those calls in, triaging them, and then either saying, oh, here's the form you need, right? 'Cause we'd have an officer drive back 20 minutes to give someone a lost plate form.
Yeah, it was weird, but it was.
Right. So this officer that's there will be multi-purpose, right? So they're not only going to answer the doors, they also have visibility of all this stuff. They help us with LPR searches. We're trying to give him multifaceted training so we can utilize him 100% or her.
So it seems like that we are expanding, we're working.
The chair would recall, but just in as much as we're dabbling into what I would deem sensitive information or maybe executive session about our operational plans. We could discuss it at a further time in terms of our plans and subsequent plans and whatnot. The question on the table is a budgetary transfer, right? So
I would just like to then just look in to see if we have that backfilled line still, if it's available, if we could use it. If not, then, you know.
on the finance side,
Yeah, I
right? Trace
would
those
like to see if we
previous
still have
dollars.
that it's still there, 'cause it was gonna be used for, like, Tony said it was going to be, the film, the glass of the schools. And then repeaters at one point, I think they were gonna use them for, but then it didn't make out, so,
That's what I was told, correct.
yeah.
So in front of, okay, but for tonight, we have in front of us the request for the fund transfers. Is there any comment or questions from members of the public on this particular fund transfer? Seeing that there is none, I make a motion that we approve the request. It's an FYI on the fund transfer, 26 T174. I withdraw my motion, okay? So item number 20 is done. Item number 21 is other business. Do I have any other business
sir.
from my colleagues? No. Any other business from other legislators? Other business from members of the public? Very quiet back there. Okay, that being the case, I make a motion for adjournment. Can I get a second?
Second.
All in favor? So carried.
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Can we have the roll call, please, Mary?
Present.
Present.
Here. And we accept the minutes. Does anybody have any changes to the minutes from February 11th, 2026? Okay, the first item on the agenda is an update regarding food insecurity. We've talked about this for 2 months now. I believe it was originally on a previous month's agenda. The legislature had previously placed $150,000 in sub-contingency to address food insecurity. And since our last meeting, I've continued speaking with stakeholders and community partners about how those funds could be used lawfully, effectively, and within the available time frame. So we're wanting to allocate this fund sooner than later. There's been a lot of great conversations and ideas, and I think we've narrowed down to what's really needed. One possibility is for Cornell to administer a countywide food purchasing. I think you're able to do that, and distribution program through the existing Putnam County Food System Coalition. That could help stabilize our pantries, which was the original intention of these funds. And it doesn't just solely address the loss of the Meals on Main program, which the seniors who are not comfortable using traditional food pantries felt a great loss from that program. So a program that all stakeholders expressed in need of support was the Bountiful Meals program, which is a collaboration with Second Chance Foods and Cornell Cooperative. So I was thinking with collaborating, and I'd love your input. This is not final. These are just thoughts. Possible framework would be to give approximately $100,000 for pantry stabilization and $50,000 to expand Bountiful Meals with a focus on prepared meals and senior access. We've also heard through these conversations that cold storage is a serious concern, and while permanent shared refrigeration and freezer hubs are a good long-term project, they require much further planning and strategy and figuring out where they can go. We spoke to Marlena Barrett from OSR, and she's been part of these conversations as well. And she's looking into, I just had the idea we can place them next to what's already there. We just need more cold storage. But tonight, again, is an opportunity to hear from stakeholders, determine what's legally and practically possible. There's no fiscal impact for tonight's discussion, and any proposal that we define, hopefully we can get to the bottom of it tonight and return to the appropriate legislative agenda for final action. And because we don't have a final resolution, we've had ideas of what they could be. I'm hopeful that with the legislature's approval, possibly, we could finalize something even by the audit committee meeting. We're not required to have anything concrete in committee meetings. You know, we're not even really required to have committee meetings by state law. So I'm hoping that we could finalize something tonight. So now I would like to introduce Stephanie Hubert, Martha Elder, Sara Servadio, if you guys would love to share your thoughts on any information that.
Want them all to come up?
And this is mostly, you know, just for Sarah's purpose. I've been talking to Martha and Stephanie and Marlena regarding this issue. So just sharing the ideas, and you've seen the ideas put forward. And of course, the law department is going to have a big stake in this. Our legislative council has been really helpful and encouraging me to do this.
So the three of us did meet about 6 or 7 months ago now in my office to talk about more to identify the top 3 or 4 issues we were going to focus on, and you did already mention them, the freezer issue. From my office specifically, we're seeing a specific population of individuals who are just over the amount of money you can make a year to receive SNAP benefits. So people on disability, the senior population are veterans. So there's a significant number of individuals in Putnam County in that group of people. And we also talked about the transportation issue for people to get to places where there is the freezers of food or to food pantries even. So we talked about how we were going to troubleshoot that issue as well.
Great. And Cornell, as far as what I'm envisioning is a pass-through to Cornell, you already have a relationship with how many food pantries again? I feel like there's 11 food pantries throughout the county.
Yeah, I think there's 11 fully formal food.
And you have relationships with them already.
Yes.
And we don't need to enter into any new contracts. This is probably just going to be a matter of a resolution. You know, basically Cornell Cooperative is an arm of the county by state law. So I think that solves that problem and trying to figure out how to get this money to the pantries. And then what everyone has said in this is that Second Chance Foods and their Bountiful Meal program really could use some resources. They could fill the gap possibly that we saw with the Meals on Main. You know, I know Meals on Main is still going to other areas of the county. It's sorely lacking on the west side of the county. So if we could pick up some of the slack through this with that funding, that would be great too. So let me know. Like, let's tell me and the legislators, is this what you want to see? I'm happy to take more ideas, rearrange this. I think I sent you my thoughts in a draft resolution, $150,000 from sub-contingency, $100,000 for pantry stabilization and countywide food purchasing, and then no less than 50 for the expansion of Bountiful Meals. Obviously, that will require some time for you to boost that program and probably hiring drivers and things like that. So it will take some time. And I'm wondering, do you think you can expend those funds by the end of the year?
Yeah. I think what I want to say is the plan is good in terms of how it's supporting like existing programs. Or, almost into August here. There's not a lot of the year left. So being able to really ramp up programs that are already in place makes a lot of sense. So yeah, Second Chance Foods, we can definitely ramp up that program to, more fully support our seniors. I know I've had a conversation with Marissa at Putnam Cap about us also providing some of these meals through the local food pantries, just to kind of expand that base that will be able to access those meals.
Great. Before I open it up, there were some things that I drafted in that resolution that I wanted to get your feedback on. In particular, there will be administrative expenses. I know members of the legislature don't necessarily like to see those funds allocated toward administrative expenses or staff. But the fact of the matter is that's a big expense for these not-for-profit organizations. Staff is needed, administrative expenses happen. And so I did say not exceeding 10% of the total funding without prior approval of the legislature. Is that acceptable?
Well, that's pretty standard now, especially federal grants as well.
Okay.
We do the de minimis of 10. So that,
Okay.
I'm happy that was at least addressed.
Okay, good. Okay, and there were other things addressed that get kind of down to fine details and your reporting back to the county. Just want your feedback on that. Did that seem too cumbersome? I think it's possible I can read.
Well, you could refresh my memory if you want for the specifics.
The administering organization, which would be probably both of your organizations, shall submit an implementation plan before receiving or expending county funds, identify participating organizations. So the idea isn't that we're going to spread this money out equitably to every food pantry. It's going to be based on need. It's going to be based on services that are lacking, which, you know, as you've heard over and over again, there's very few over on the west side of the county. Anticipated allocation of funding, proposed program period. I think that might not be, I don't think we need that, but location where food's going to be distributed, we'll lay out, and periodic reports to the legislature and the appropriate county departments.
Yeah, I don't see anything out of whack with that. I mean, it's pretty standard for what we do at Cornell anyways. I think as long as that there's an agreement with the type of metrics and data that everybody wants to see, it's fine.
Great. I want you to give me as much input as you can, and don't be afraid to. So with that, I'll open it up to the committee to see if they have some questions.
Well, I know the last time we did, we were discussing the cold storage, and I think that's very important. I just don't know where it would be located. Would you have any idea of where, if we had the freezers, where they would go?
So we did talk about utilizing newly acquired space in the DSS building.
Okay.
In the basement. So we are looking into that. We also think that the Cold Spring Phillipstown area is in desperate need of refrigeration over there. So that's what we talked about.
We could do it 2 locations. Good. That would be great. Okay.
I think that consistent feedback into my office and the Office for Senior Resources is that the prepared meals goes the furthest with our individuals. So Bountiful Meals is preparing 100 meals a week to 8 locations, right? So we did talk about expanding that to delivering twice a week to the same locations. Again, for my office and the needs of the people calling my office, it's the prepared meals that makes the difference.
We've, if I may, sorry. We talked about cold storage and freezers. The prepared meals will go into a refrigerator, correct?
They go into
a freezer.
freezers.
Okay, great, thanks.
Oh, no.
Anything else?
No, I'm good. Thank you.
Or, great. Anything from other legislators? So my wonderful stakeholders here worked really hard and gave me a lot to go on, and I did prepare a draft resolution. I'm not going to read it now. I did share it with the stakeholders. I didn't share it with Sara. I'm sorry. But I'll pass that around, and I don't know legally if we come to a consensus or if I submit this resolution, if it can go on another agenda this month, particularly audit, or does it have to come back? Doesn't necessarily have to come back to it. It was just today. Just
Okay, so then I guess you could pass it in concept to audit, just to make sure everybody has seen it and.
I don't know if my colleagues on the committee are willing to do that.
I didn't know which.
Yeah, well, I was thinking
I didn't.
audit can pass it on to full. Yeah, that's possible. So.
Pass it in concept, you described what it is.
Okay.
Pass it in concept to pass on to audit.
To send it to audit.
Okay. Are you comfortable with that?
Yeah.
Okay. So can I have a motion to pass on the concept of a food security resolution and a budgetary to release the $150,000 from sub-contingency for countywide food security initiative?
I make a motion.
Second.
All in favor?
Aye.
Great.
Great.
Thank you. Thanks for all your input and your work, and thanks.
Sure.
Thank you.
Thank you. Thank you.
Okay, we have other things, don't we? Okay, so item number 5 is an FYI. Collaboration between mental health and probation. We did that already. So we're moving on to number 6, approval of budgetary amendment 26A066, Department of Health for school flu clinics. And we have our wonderful Director of Health, Rian Rodriguez, to talk about this great program that is back, which I'm so happy about.
Correct. So good evening, everyone. Yes, we are requesting a fund transfer for the school-based flu clinic. As some of you may be aware, last year we were not able to do the flu clinic during last year's flu season because we were lacking nurses that would be needed to do the immunizations. Now that we are fully staffed, we are reinstituting this program. So we are requesting the fund transfer of the $18,000 to buy the biologics as well as the necessary medical supplies. It is 36% reimbursable under state aid. So, minus that, that's the deduction there. So I think the overall ask there was $11,540.
Thank you. I don't really have any questions, just to say I'm really pleased to see this back, and I want to make sure we do have the nursing capacity, and that nursing capacity, we're not taking away from other nursing programs by doing this. We have capacity to manage all of it at this point, somewhat.
That we do. We have a core of some relatively new nurses, so some of them are still going through the training protocol. But in terms of full FTEs available and necessary to be able to programmatically do this, we're able to do so.
Thank you. Any questions from the committee?
No, it's great.
Wonderful. Can I have a motion to do that? Yeah.
Is it a motion?
Approve the
Yeah.
budgetary amendment 26A066.
I'll make a motion.
Second.
Second.
All in favor?
Aye.
Great. I lost my agenda. Okay, the next item on the agenda is item number 7, update on the Department of Health PFAS pilot program quarterly update. Thank you so much for coming out for this. As you all know, we were awarded funding from New York State. Thank you, New York State, as this pilot program to address this contaminants or have our wells tested for contaminants. And from what I hear, it was a really popular program. I'm sure a lot of work for you. And we have Brian Stevens from Environmental Health here too. Thank you, Brian.
Correct. So once again, grateful for both the state providing the funds and this legislative body for supporting this programmatically. As you've indicated, it's become quite popular. Brian, in a moment, will sort of go over our preliminary numbers. We're sort of only one quarter into this. So this is sort of a learning process, not only with us, but with the state as well. But it seems to be very well received at this point. So with that, I'll hand it over to Brian, and he can go over some preliminary numbers with you.
Okay, so as you're aware, we're entering our 5th month with the state PFAS rebate program. There's been 540 applications for testing from Putnam residents. Of those, the state has completed 480 of those samples, and they are on a regular basis notifying those residents of their results. And if they do exceed the MCL, they are approved to install treatment. A lot of those sampling that's occurred and the exceedances of the MCL are pretty widespread throughout the county. So now that they've notified those residents that they can install treatment, we're in the phase right now where that treatment is being installed. We did just receive our first request for rebates, first of many to come into our department. And in the next week or so, the state's going to be providing additional training on how to process those payments and those applications for the rebate.
So the rebate is for the repair.
For the work, the installation
work.
of the treatment.
Wow, that is a lot. That's a great program. So have they released the results? It sounds like they've released some of the results of that testing.
Yes, they've given us a general idea that that there are exceedances throughout the county, that it is widespread, and that
So that's my question. Are there any areas where it's concentrated? That's my biggest concern.
So I would caution that this is really around proof of concept. So we do have an exceedance rate right now of a little over 20%, but this is really sort of about creating that baseline. So we're really casting a very large net here, where hopefully then we can go back and use that data to really come up with something that's more impactful in terms of identifying what potentially may be clusters. So I would just caution, right, this is very early in the program. This is a particular snapshot in time. We don't know if that exceedance rate is the result of, whom is being tested. So at this point, I would just sort of caution, take that with a grain of salt. That is sort of a static number. But as the program develops and we come here quarterly, we will bring that information to you. But I just want to sort of caution that, this is very preliminary, sort of in terms of this program.
Yeah, on that note of being cautious, is the state offering any guidance as to homeowners' privacy? Because that's a big deal.
Yeah, so they've controlled the information. There's a few people in our office that had to sign disclosure agreements for that information, because we are going to need that information in order to process the rebates, but they don't want that information available to the public.
Yeah, and I did have some homeowners think about doing the testing, but then not wanting to do it for
Right.
the resale of their home. So that's a big concern.
We've
too.
received calls, people concerned about that. We've tried to talk them through the process and that information is guarded.
They don't have to disclose it if the house is.
Well, we wouldn't disclose it.
You wouldn't.
Yeah, I'm not sure on their end what they might
would
have to,
They would have to.
I'm sorry, yeah.
Yeah,
as
you're
a real
right.
estate agent, yes.
You're the one to ask. Yeah.
No, you would have to
Um,
disclose that.
I don't have other than so the $300,000. Has that all been spent? Is it
No.
How much is left?
None of it has
And-
been spent yet.
Right.
Because we're just getting the rebates applications submitted to us. That money is encumbered by the state, but hasn't been passed down to us yet.
And considering the success of the program, 1.5 million was allocated?
Yes.
Do you think we're going to go for it all?
So most likely and much sooner than anticipated. This was supposed to be a 5-year program.
Yeah.
We will run through that money if these numbers hold. The trajectory of here will get us through that funding much sooner.
Thank you. What a great thing you guys
Yeah.
have done.
Yeah.
Thanks. Any questions from the committee?
No, I just want to say it's a great program.
Yeah,
I'm glad
thank
to
you.
see that. A lot of people will be helped and the wells contaminated and
Wait, I do have a
it's very, very important for resale, for their homes and for the safety.
Right.
Thank you.
I do have a question. Is every resident reimbursed the same amount? Or does it
There's
vary on?
3 categories. For the average resident will be reimbursed $5,000 for a full system. For homes that can't have a full system installed because there's space constraints or other constraints, it's $1,000 for a point of use system. Basically, like your kitchen sink would be the only thing that's treated. And then on a very rare occasion, if there is public water available in the street that they can hook up to, that's a $10,000 reimbursement. But we don't expect to see many of those.
Not much public water.
Right.
But, Legislator Regan.
Thank you, Chair. There we go. Thank you, Chairman. So it was my question was in line with what Legislator Russo was asking there, but I guess I'd be more specific. Is there a general average outlay from each one of our residents as they try and remediate? The remediation is the installation of equipment, filtering equipment, right? So
Price that they're paying, you're asking, or?
yeah, in other words, well, just walking it down there for a second, right? Is there one vendor that everybody has to go to? Do you have, do people have options?
So there's many options. They
Okay.
call anybody that does that work, that they could work on getting that installed, and it would be acceptable as long as all the components that are required are installed. With that being said, we haven't received applications yet, so we don't know what the pricing is out there and how much of the 5,000 is actually covering. If it's $2,000 in addition, or
To see how hard it's going to hit, right?
Yeah.
Okay.
But the state is asking, part of the process is capturing that information, because I assume, it's a pilot program. I'm not sure what the next phases might be, but the state's trying to capture that information to see what these systems do cost.
Thank you. Thanks.
Thank you.
A quick question
Sure.
related to your question. Will there be straight across the board the same pricing? Because there are different companies that would come in to do it. Is that
No,
So
we've,
that could be.
anybody we've talked to, we told them get a couple prices because,
Okay, so yeah,
this
so you could-
person
yeah.
sources their parts this way or this sizing based on what their, what size usage they have in their residence.
Gotcha.
Great.
Thank you.
Our legislative counsel, Heather Bissy, has a question.
Is it going to be a reimbursement that they supply, like, let's say a receipt for whatever the system is, and then they get reimbursed up to that amount? Or is
Yes.
it a flat rate?
I believe it's up to that. Most are going to exceed, I think, the 5,000, but they have a whole schedule of what has to be installed, pictures that have to be submitted.
But if it came under, they would only be reimbursed under the amount, they wouldn't just get 5,000, like if it costs 2,000, they
Right.
wouldn't just get.
Right.
Great. Thank you very much for bringing that program to Putnam, and thanks New York State for another great program. So our next item on the agenda is other business, and we do have, I'd like to recognize Cassandra Roth, Chair of the Putnam County Soil and Water Conservation District. Cassandra asked for just a few minutes to discuss the harmful alga blooms. I don't know if you want to stay for it, related to beach closures we've been seeing around Putnam County. The Health Department's role is to monitor, test, and protect the public when a bloom occurs. Soil and Water can play a role, and we're really glad they're here, by looking more closely at the watershed conditions that may be contributing to the problem. Oh, and I'd like to make a motion to accept the additional, which is Cassandra's note.
Second.
All in favor?
Aye.
Thank you. Take it away.
2 hours and 3 minutes.
Yeah. That's right.
Talk slow.
I will. Cassandra Roth, Chair of Soil and Water District. So I don't know. I want to read something very, very brief. But to the extent that as our district has become autonomous, as our district has started to look into, we now have staff. We are looking into the things to prioritize, right? The things that are most impactful, the things that, the best bang for the buck, right? And our district has already had conversations about trying to, at some point here, do a collaborative approach with the lake communities and things like that. I will say that is some of the biggest outreach and the biggest excitement of our new revived district has been the lake communities. There's a detached approach that we've found, and they're starving for resources, for whatever reason. Sometimes it's just because they're all in different towns. Specifically on this, though, I know, to our knowledge, it's obviously the Department of Health does a great job in recording and, taking the calls and marking when these problems are. But our district is not aware of is if there is any willingness of the county for us to play that role in the research and in the identifying of how to prevent these in the future and the mitigation of the things. Like, I don't know, because again, our district, we don't own these parcels. I'm just here for an idea before we send our staff down a great journey of, from what I've already found in a cursory level, various grants that total up to $200 million throughout the state. Various different grants. Some are specifically for HAB research. Some of them are for, pollution source research and treatment and mitigation. But I'm trying to get an idea of what exists already. So before I kind of go further, I'd just like to get an idea of what exists already in a very brief way of if there's things already being done, if these grants are already being applied for. There are some grants that we can apply in tandem where the county would be lead agency, let's say under the health department, and we would be, the subsequent. There's others that we can both apply where we can be lead agency on one and name the county in another. So there's a lot of ways that on a prelim we've identified. I just hate seeing that the beaches are closed in Putnam, right? And we heard Legislator Goulman speak about Veterans Park. It was one of the only parks, that's lake did not have green algae. So how do we prevent that? We want to be a resource, but we also don't want to be duplicative, and we also don't want to step somewhere where we're not wanted or needed. So I'm just trying to get an idea, possibly from the Department of Health, possibly from the Legislature on what that is. I mean, I can go into, the various fundings that are available throughout the state and just ballparks. There are still some that are open for this year. Many of them have passed. There's still at least 1 or 2 open. But we can also, in addition to trying for this year, we can plan for next year. So I'll stop there for right now.
Yeah, I really appreciate that initiative. This has always come to me as a legislator through constituents. Sometimes they alert me to the funding opportunities, and I have in turn provided that to the previous soil and water district
Department.
And I don't know what's been applied for. I don't recall actually seeing anything. So
Nothing from soil and water, because I don't think through DPW they would have, but perhaps the health department, if you guys had applied for anything that you're aware of.
So this could be a great partnership that I would welcome with DPW, the health department, and soil and water, because it is one of the hot topics with my constituents. And I think there's a great opportunity because soil and water already, and the health department already does a lot of public outreach, a lot of public education. What we have in this county are lake communities, and they're usually lake associations and civic associations that have monthly meetings. And it would be great if soil and water, or sometimes the health department, could go to those with public education, and then in turn also providing the county, if you're doing the research, with an opportunity to apply for those grants. I'm not saying that soil and water is going to take on that role of applying for the grants, but assist the health department, putting it in front of them, or assist the administration in applying for or planning.
We could do both. And that's kind of why, one, we can go apply for grants tomorrow, right? But they're not our properties. So we would have to enter into IMA, MOU, don't care what we call it, really can't repeat that enough. I don't know if it's on individual parcels or as a collaborative effort across the county. We could apply for grants, but we can't use them to implement until we know that the county wants to, right? Because we're applying for money that we don't have authority to go do that research, go do those work. So I think that was the broader thing. We're happy to send our staff down the great journey of all the grants, because on a quick search, there is a lot. And some of them have a low as a 10% match, which is in-kind services, which we already have staff we're already paying for, right? So we can identify them. We can apply for them on our own. But again, there's no point in us applying for them. You know, we deal with this. We saw, Dixon Lake and things like that. There's just, unless it's wanted, there's no sense of us sending our staff down a journey to find grants that we can't utilize, even if we get awarded the grants.
I would want the resources to answer to my constituents. I think this would be a great question for our legislative attorney. A lot of these organizations, these civic associations, are not legal homeowners associations. I think it might be a law issue at some point when we do finally find a grant that could help support a private community, but we've entered into those agreements before, and I think we can do it again. Do you see any obstacles with it?
It really is.
It depends.
Specific to
Yeah.
whatever the property at issue is. I mean, obviously, if a community wants soil and water's assistance, the community can ask for soil and water's
Mm-hmm.
assistance. So, I mean, I think outreach, whether it be, soil and water alone at each of these lake community associations, to educate them as to the availability of soil and water's assistance, would put no middleman. It would be literally the associations who want the help getting the help directly from soil and water. But I think what Cassandra was presenting here is recognizing that the health department has a role and function in making us aware if there is a, health concern related to contaminated water, algae water, things like that. And I think what she was trying to identify is there some sort of way in which she could assist the county on a county level when these problems are identified, instead of just telling us, hey, there's a problem, in mitigating the problem. So she's explaining that the county has the opportunity to use soil and water as a resource, so that instead of just knowing we have issues, fixing them. So I think that I don't think they're mutually exclusive. I think all of those things are possible.
I think it's a great opportunity. And we have legislative representation on the Soil and Water Board, so I think we're okay. And there's only one organization so far in Putnam County that's been addressing this. They have an annual meeting. Lots of the lakes organizations attend that, and this could just.
So there's three different, for clarity, the county, right, you're responsible for certain ones. I can think of 3 examples off the top of my head that are 3 different structures. Only Two, do we need county, understanding and agreement on, like if there's a lake district, right? We can work directly with them. Heck, we are going to go inform them that they can apply for these grants. So the districts themselves can apply. We can apply. But when it comes to something like, let's say, Dixon Lake, that specific area is owned, it's a parcel that is owned by the county. So we can't go do research. We're not going to go do things. Heck, we can't deal with invasive species if we want to without, an agreement with the county. But same thing with like Lake Lenida. Can't do that either.
But I think.
So the districts we can work with, the formal bodies, those we're going to work with anyways. It was more so on the parcels and the areas and the lakes that the county owns or maintains is what is wanted from us. If, you want us to go down those grant rabbit holes and bring that and work in collaboration with you guys, let you know what we're intending to do and then see if you'd like to join us. So we'd love to do that.
Yes. Through the chair, we already have an IMA with Soil and Water, so they're already in partnership with the county, and we're already able to, allocate funds to them as part of that IMA. So if there were projects or things that the legislature had interest in allocation, the infrastructure from a contract standpoint is already there. It would just be a matter of utilizing it because we have the opportunity to appropriate monies towards certain projects that we can either, appropriate towards Soil and Water, or alternatively, we can authorize the application on our behalf of grant monies, which then we would, as we've seen all these grant approvals, can then authorize to be utilized through Soil and Water. So really all that would need to happen, because we already have an IMA in place, is legislative authorization. So, you would get information, whether it be from the health department or from information they present, and you would,
We would be on an individual basis. But certainly going out, it's already in the IMA, it's already part of your duty to go out.
We're already educating and telling everybody there's grant money in New York State, but just to specifically come to you guys and say, this is, if that's something that is a want, we will send her on a further journey. But if it's something that you guys are like, we got it, we're applying for grants and we don't know about it, we don't want to step on anybody's toes either.
And we would really, we have nothing to vote on, but the consensus.
I agree. Absolutely. Yeah.
And if it needs a more formal agreement, we can do that as well. Thank you. Thanks for your work, Cassandra.
Thank you.
We do have one last item of other business.
Sure, I was just going to add in regards to that. We're always, happy to collaborate with any organizations or bodies out there that are looking for better stewardship of the environment. That said, there are opportunities where we can offer letters of support as well. Oftentimes, because of the fact that we're a government agency, there are certain limitations where it probably makes more sense for us not to be the lead agency. But, there are scenarios in other grant applications and submissions where we work collaboratively with some CBO and have them sort of seek grant funding as the lead agency. So if there are opportunities like that, we'd certainly be willing, to collaborate around those. I also wanted to just sort of add, from a data standpoint, at least currently, the majority of our beach closures are due to bacteria and not HABs. So while that's still a significant issue, we want to be able to ensure that we're addressing sort of both sides of the research piece here. So I think we can actually broaden that as well.
Septic issues. Thank you.
Great.
Thank you.
Thank you. Any other business?
Yes, I would like to just say that July is globally recognized as Bereaved Parents Awareness Month. National Bereaved Parents Day honors parents who have lost a child from any circumstance. It is supportive observance to reduce isolation and educate the public. May we as a community offer support and understanding and extend our compassion to every bereaved parent, remembering the children whose memories live on in the hearts of their families. Just wanted to recognize that in July.
Thank you. That's a really important recognition. I appreciate you bringing it to our attention, and it just gives us an opportunity to say that there are resources out there. The Phillipstown Behavioral Health Hub does have a grief loss group I think it's weekly. And there's other national organizations, and the social service department has those resources available if you need. And I can always give you the resources too. Thank you. Any other business? Can I have a motion to adjourn?
Motion to adjourn.
Second. Oh,
All in favor? Yeah.
Aye.
Still not used